Esto no funciona. Buenos días. Good morning, everybody. If you can start taking your seats, please, so we can start the directing council. Buenos días. Y si toman el asiento, podemos empezar la reunión. Gracias. Good morning again. If the delegations can take the seats so we can check the quorum and start the 61st Directing Council. Thank you. Good morning again. My name is Nicolás Lagomarcino from the Office of the Governing Bodies. Just so we don't have problems, we have interpretation in 4 languages, in the 4 official languages. If you can check now, we try to set up in the language that your mother tongue, but you need to verify that you have interpretation working, so we don't have to stop the proceedings of the council. You have a screen, and it shows, if it doesn't show the language, you have to press twice, and you will see French, Spanish, English, and Portuguese, and you choose the one of your choice, and it should be okay. It's not that it's not working, but you need to choose. If you don't choose the language, you will only listen to the floor. And if you have any problem, you can just call any of the member of the Secretariat, and we'll be happy to help you. Thank you very much. So I'm informed that we have the 22 is the number needed for quorum, and Dr. One second, we have quorum, so we will be ready to start in a few minutes. Thank you. Thank you very much. I think we will start. If we close the door, please, so we avoid any unnecessary noise. And thank you. Mr. President, whenever you want, we have the quorum. Thank you.
Buenos días.
Good morning. Good morning to all distinguished delegates. I would like to report that due to the fact that my country, Panama, was the president of the 60th Directing Council in 2023. We held the presidency of that 60th Directing Council. I will preside over the council until the new president has been elected. I now yield the floor to Dr. Miguel Punier, legal advisor of the Pan American Sanitary Bureau, who, as Secretary of the Directing Council, will report to the DC about the quorum.
¿No está el presidente de la Secretaría?
Muchas gracias, señor presidente. Good morning. Rule 5 of the Rules of Procedure reads, the presence of a majority of members and associate members shall constitute a quorum for the opening of the session of the Council. As there are delegates from 30 member states present, there is quorum. Thank you, Mr. President.
Gracias, señor secretario.
Thank you, Distinguished Secretary. Next, I will bring to your attention the members of the head table, Dr. Jarbas Barbosa, Director of the Pan American Sanitary Bureau, Ms. Lois Pace, Assistant Secretary for Global Affairs of the United States Department of Health and Human Services. His Excellency Pablo Ibarrarán, Social Protection and Health Division Chief of the Inter-American Development Bank. Mr. Derek Walton, Legal Advisor to the World Health Organization. Dr. Miguel Punier da Silveira, Legal Advisor to the Pan American Sanitary Bureau. Mr. Luis Almagro, Secretary General of the Organization of American States.
Como Estados miembros comprometidos
As member states committed to the progress of the region of the Americas, we have on us the great responsibility of empowering the powers and faculties of our national health authorities as an essential step in order to ensure universal access and universal health coverage. It is of vital importance to head the efforts in order to strengthen the national health authorities, the improvement of regulations on public health supplies, and the optimization of the management of people working in the health sector with the main objective of achieving significant improvement in the quality of the well-being of all our populations. Besides, it is of extreme importance to promote the provision of health services, in particular for the benefit of the most vulnerable communities and those who are socially underprivileged. In order to attain this goal, we ought to promote the creation of integrated networks of health services to promote the digitalization of the health system and to work in order to reduce disparity in health, emphasizing maternal and child care and the aging population.
La adopción de
The adoption of a comprehensive integrated approach in order to counteract the impact of non-communicable diseases and therefore the burden of disease and death attributable to them, promote the mental health is essential and ought to be based on the strengthening of primary health care. This implies strengthening surveillance of non-communicable diseases, updating legislative frameworks to promote prevention and improving health services, including those of mental health, with the main objective of ensuring health and better living conditions.
Asimismo, es esencial promover la colaboración
Likewise, we have to promote intersectoral cooperation in order to reduce the impact of communicable diseases, which includes promoting surveillance, updating legislative frameworks,
protección de los logros en vacunación, avanzar la eliminación de enfermedades y reforzar la prevención durante epidemias y pandemias.
And respond to epidemics and pandemics. And finally, it's extremely important to work on a collective basis with dedication to import the capacity for comprehensive management of risks under emergency situations, natural disaster, or the vulnerability of certain population groups. This requires coordinating our response to an emergency and improve our capacity for comprehensive risk management to protect the health of all citizens. For Panama, it has been a privilege to have presided over CD60, and we hope that the work accomplished will have led to the decisions that will favor the health of the Americas. We are quite sure that with Paraguay as the head of this table, we will continue to move forward with our goal of strengthening health in the region of the Americas. And no doubt, we serve as an example to other regions of the world. Thank you very much.
Deseo conceder ahora las palabras al director de la
I now call on the director of the Pan American Sanitary Bureau, Dr. Yarbas Barbosa, to speak some words of welcome. Thank you very much, Mr. Chairman.
Minister of Health of Panama and President of the 60th session of PAHO's Directing Council, Honorable Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, that is connected, and will address this meeting in a few moments, but is also represented here by our esteemed Derek Walton, who is the WHO Legal Counsel, Honorable Ms. Lois Pacey, Assistant Secretary for Global Affairs of the United States Department of Health and Human Services, Honorable Mr. Luis Almagro Lemes, Secretary General of the Organization of American States, esteemed Pablo Ibararan, Chief of Social Protection and Health of the Inter-American Development Bank, distinguished members of the Directing Council, Excellencies, colleagues, ladies and gentlemen, welcome. A special thanks to the esteemed ministers of health from across our region that were able to join us in person today. It is an honor to be here, surrounded by so many valued colleagues and partners who I have had the privilege of working with over the years. Your trusted partnership remains a source of pride and strength for this organization. Let me begin by expressing my solidarity with the people of the countries affected by Hurricane Beryl. Hurricane Beryl raged through the Caribbean this past July, leaving behind serious damage in Grenada, St. Vincent and the Grenadines, and Jamaica. We know that climate threats like hurricanes can severely damage health systems, especially in vulnerable communities, making it even more difficult to treat the people affected by these emergencies. PAHO has stood and will continue to stand with you to restore services, build resilient health systems, and protect the health of your communities. This collective support is the foundation of our work for the past century. Today, we started the 61st session of the Directing Council, and throughout the week, we will be discussing 6 technical matters, such as the strategy and plan of action to decrease the burden of sepsis through an integrated approach 2025-2029, the policy for strengthening equity-oriented health sector action on climate change and health, the plan of action for strengthening information systems for health, 2024-2030, the policy on long-term care, the strategy for strengthening the essential public health functions to accelerate health systems transformation, 2024-2034, the strategy and plan of action to strengthen tobacco control in the region of the Americas, 2025-2030, the strategy on integrated emergency, critical and operative care, 2025-2030, the strategy on epidemic intelligence for strengthening early warning of health emergencies, 24-29. So we have many relevant topics that are challenges for all countries in our region. We will also review the report of the end of the biennial assessment of the PAHO program budget 22-23, second, interim report on the implementation of the PAHO strategic plan 2020-2025, 5 final reports and 3 progressive reports on different technical matters. This November marks the 100th anniversary of the Pan American Sanitary Code, ratified at the 7th Pan American Sanitary Conference in Havana, Cuba. This code set out to prevent of communicable diseases, encourage information sharing among countries, and standardize health approaches to prevent diseases transmitted across borders. 100 years later, these themes still resonate. Member states are now finalizing the negotiations of a new pandemic accord, building on these pillars to protect against future global disease outbreaks. In May this year, during the World Health Assembly, member states agreed with the amendments to the international health regulations in order to better prepare the world to future events of public health concern. Noting the crucial importance of the meaningful participation of our member states in the pandemic accord negotiation, PAHO has convened 4 face-to-face regional meetings that enable the national and regional implications and to agree on more than 16 joint statements on key issues. The Secretary has prioritized its support for the voluntary external evaluations of their international health regulation core capacities in the Caribbean, Central America, and South America, to identify the priority interventions and recognizing the need of additional financial resources. The Secretariat has supported the mobilization of financial resources for epidemic surveillance, laboratory capacity, and emergency workforce through successful proposal from the first round of the Pandemic Fund, and additional resources may be soon available from second round that will be announced in the next days. The COVID-19 pandemic revealed Latin America and the Caribbean structural dependency on imported vaccines and other health technologies, geographic concentration in innovation and production capacities, and vulnerable global supply chains. As a response, in 2021, our 59th session of the Directing Council recognized the commitment to increase production capacity for essential medicines and health technologies in our region. In 2023, we created the Innovation and Regional Production Platform of Medicines and Health Technologies, which will work in hand with our regional revolving funds to promote the generation of regional ecosystems and initiatives to strengthen capacities for innovation, development, and production of health technologies, as well as facilitating technological transfer processes and boosting capacity to develop and produce mRNA vaccines in Brazil and Argentina to serve all of our region. With technical support from PAHO and funds donated by the government of the United States, El Salvador recently inaugurated a Center for the Quality Control of Personal Protective Equipment at the National Regulatory Authority, which will serve as a sub-regional hub to assess the quality of particle respirators, masks, gloves, among other products. The hub is part of a PAHO project aimed at strengthening the capacity to produce essential health technologies following the COVID-19 pandemic, as well as reduce external dependency on these products, which are mostly produced outside our region. A similar initiative is on the final stages of implementation at the Colombian National Regulatory Authority in Vima, which will serve as a quality control hub for South America countries. PAHO is in advanced negotiations with Pfizer to localize and provide early access to one of the most advanced vaccines in Pfizer's pipeline. This potential localization involves a local manufacturer based in Latin America, with whom Pfizer already has a relationship and will start a tech transfer process. This initiative would be a concrete example of PAHO's effort to leverage the revolving fund to strengthen the regional production of vaccines and build the capability to foster and develop pandemic preparedness in our region. Last year, PAHO relaunched the Elimination Initiative, an effort to eliminate more than 30 communicable diseases and related conditions in the Americas by 2030. These diseases affect the poorest among us. They feed the vicious generational cycle of poverty and disease. Families who can't afford preventive care and the most vulnerable to falling ill, and the least able to afford treatment. Ending these diseases is our clearest path to reduce poverty and inequality in the region. To date, 19 countries have eliminated malaria, and 11, mainly in the Caribbean, have eliminated the mother-to-child transmission of HIV and congenital syphilis. Jamaica, Belize, St. Vincent, and the Grenadines received their certification of elimination of mother-to-child transmission of HIV in May this year. On this note, I also to congratulate Brazil for the elimination of lymphatic filariasis as a public health problem. I am proud of these advances in our region, and PAHO is committed to accelerating these efforts with you. In the last 2 years, countries in the region managed to halt the decline in routine vaccination coverage and even achieve an increase for most antigens, reaching 88% regional coverage for the third dose of DPT in 2023. However, this progress is still below our 95% target, indicating that our efforts need to be strengthened. In addition, there are 22 countries in the region that have not managed to recover their coverage from the pre-pandemic level. The situation, coupled with surveillance systems and outbreak response capacity that are not ideal, puts at risk the elimination gains we have made so far. Likewise, despite the fact that there are still 3 countries pending the introduction of the vaccine against the human papillomavirus, a great challenge remains in achieving coverage, which stands at the regional level of 77% for the first dose at the age of 15, which is still far from the 90% as the minimum necessary to facilitate the elimination of cervical cancer. It is imperative that we continue to work towards a full recovery of this immunization coverage in our region. It is an honor to highlight the strong and ongoing collaboration between PAHO and the Inter-American Development Bank on Information System for Health and Digital Health, a partnership that reflects our shared commitment to advancing public health in the region. Together, we are actively working with 20 countries supported by the IDB loans exceeding $900 million, all aligned with the Information System for Health framework. This strategic approach is driving transformation in the way information systems and digital health are managed and utilized, ensuring improved health outcomes for millions. Additionally, critical projects such as the Pan American Highway for Digital Health, telehealth, artificial intelligence, cybersecurity, cross-border interoperability, and digital vaccine certificates, among others, are leading the change in revolutionizing public health in our region. We are also pleased to announce that the World Bank has recently joined these efforts with over $200 million in loans already in place under the same framework. This united collaboration exemplifies our collective determination to strengthen health systems, improve access to care, and ensure no one is left behind across the Americas. I am also glad to inform you that this month we will release the first ever regional report on the maturity level of Information System for Health, with comprehensive data from all countries and territories of the Americas. This report will establish an evidence-based baseline, enabling all partners to join forces with one common goal: supporting our member states in building more resilient and equitable health systems. Permítame ahora cambiar al español.
Please allow me to switch to Spanish. Based on all these initiatives that we have, primary health care, the spine of all health systems. Primary health care is an instrument for equity and our first line of defense against outbreaks, our best investment in order to improve health indicators. The Partnership for Primary Care in the Americas, which was launched in December last year in Uruguay, is a huge step forward for our region. This strategic cooperation between the World Bank, the Inter-American Development Bank, and PAHO has created a united vision towards a primary health care that raises access to health services and strengthens health systems. In the Dominican Republic, for example, new investments by the World Bank and the IDB are addressed to maternal health care programs, digital health, and the control of non-communicable diseases under a new mechanism for cooperation and coordination called Alliance and Partnership. This supports similar initiatives in the 10 countries that have requested support through this innovative mechanism. Primary health care will assist us in facing the severe challenges present in the region. Amongst these, non-communicable diseases, which account for 81% of the deaths in the Americas, of which 35% are premature and preventable deaths. This represents a significant cost for families and for the social and economic development of countries, expanding inequity gaps. PAHO has committed to provide support to member states in this essential effort. With the initiative of better care for non-communicable diseases, PAHO undertakes the commitment to support countries to develop plans in order to improve integration of services for these diseases, to be able to reach neglected groups with medicines and innovative technologies, and to train health workers in the detection, diagnosis, and the treatment of non-communicable diseases. Cardiovascular diseases are the main cause of death in our region, accounting for more than 2 million lives a year, more fatalities than any other disease. Ministries of Health coordinate the Hearts Initiative in the Americas with the cooperation of local actors and the technical support of APAJO and other partners with Resolve to Save Lives and the Global Hypertension League. To date, 33 countries in Latin America and the Caribbean have undertaken to implement Hearts. In fact, 8 countries are already implementing the program all across its primary health care network. In order to better perform our role, a year ago, I set in motion the initiative PAJO Ahead in order to review our operations so that we can better respond to the needs of member states. We already see results during this first year. We have seen an increase in the delegation of authority to representatives of PAJO in the different countries in order to beef up efficiencies and speed in administrative processes. We've increased efficiencies in the regional revolving funds, improving their processes in accounts, monitoring of balances of countries, preparation of accounts and statements to member states, preparing the reports of 3 external evaluations, and the increase in the number of internal audits from 8 to 12 every year. The program and budget portal of PAJO that has already been launched and which enables countries to follow the implementation of the budget of the organization in real time. We have implemented Green PAJO's initiative in order to determine the total of gas emissions generated by all of PAJO activities in the region, a great step towards the sustainability of our organization. At the beginning of September this year, we launched the renewed version of PAJO Forward 2.0. This plan will assist us in strengthening our support to countries where we carry out our essential work and where we find the most urgent needs. We are allocating practically all financial and human resources at the level of a country so that we can provide a direct technical support wherever it has the greatest positive influence. Besides providing direct support to member states, the role of PAJO consists on advocating for our region. Too often, unfortunately, international organizations do not grant any priority to Latin America and the Caribbean in global conversations. I firmly believe that with the resources and the right tools, our region has the capacity to translate into practice the vision of PAJO on equity in health throughout the entire region and attain the objective of universal health care. We have the possibility of changing the lives of millions of people. I undertake this commitment and will use the full strength of our organization in order to reach the objectives and commitments that will be adopted in the course of this week. This force stems from each member state, from each professional in our team, from every partner. Together, we share a huge ambition that moves us forward, the ambition of improving the health of all people in the Americas. Thank you very much.
Merci beaucoup.
Concedo el uso de la palabra
I now call on the Undersecretary of Global Affairs of the Department of Health and Human Services of the United States of America, Mrs. Lois Pace.
Thank you very much. Buenos días a todos. Bon dia. Bonjour tout le monde. I welcome you to Washington, D.C. I want to acknowledge Director Barbosa and thank him for that comprehensive address just now. Also acknowledge my fellow distinguished leaders here on the days, but also not fellow ministers, but ministers who have joined us in the room and other distinguished delegates. I also have to comment that I am proud to offer a bit of diversity for our panel here this morning. But on behalf of our Secretary of Health and Human Services, Secretary Becerra, I wanted to again appreciate PAHO for convening us for their 61st session of the Directing Council. Obviously, the Biden-Harris administration is quite keen on and committed to the various priorities that we'll be discussing this week. I also know that this meeting comes on the heels of another busy UN General Assembly, and so to those of you who are adding this to their travels, bless you. You will rest soon enough, I hope. Just to say some things briefly, we, of course, acknowledge that we are still very much recovering from COVID-19, and I think that that cannot be said enough. But we also continue to face other concerns, including outbreaks, whether that's dengue, oropuche, or other issues and priorities that we are tackling in order to prevent what could be another pandemic. PAHO, in that case, has continued to rise to the occasion always. And so I think we should congratulate the staff here and ourselves for leading in that regard. We also, here in the Biden-Harris administration, have been happy to stand with PAHO over the past several years, not only as they tackle issues related to global health security in our region, but more broadly, issues of health access and equity and solidarity. We know that only through working collectively can we truly improve health outcomes in our region and achieve the PAHO priority of universal health for all. I'll also add how much it's important and critical for us to work at the intersection of health and other human development issues such as climate, but also migration and a myriad of other challenges that we face. Speaking of last week, I will also congratulate us for the progress we were able to make on antimicrobial resistance. The Secretary addressed the General Assembly, or the high-level meeting then, and reinforced our commitment here in the U.S. to tackling antimicrobial resistance as a top global concern, including in global health security, but more broadly in global health. And of course, the U.S. expresses our support and intention to continue working with the global community in driving action that was agreed last week to prevent infections, but also ensure access to quality diagnoses and appropriate treatment of infections. We're also looking forward to next year's high-level meeting on non-communicable diseases, noting that that continues to be a priority in our region and the world, and are grateful that we will be emphasizing mental health as part of that conversation. I know in this room last year, some of us shared personal stories around mental health, and I think I saw Minister Tufton here. I know that the Prime Minister of Trinidad and Tobago also has, Antigua and Barbuda also has spoken to this as a priority for them, and many others in this room. And so we are grateful that that will be seen as a priority alongside the NCD agenda. As people might know, our U.S. Surgeon General has been quite focused on mental health in the context of social connection, but more broadly as well across our department. And we believe in a whole of government strategy to truly transform mental health care for all Americans that encourages and urges action for youth in particular, as well as building social connections to combat loneliness and those in crisis. Regarding additional negotiations and global policy conversations, I am glad that Director Barbosa mentioned the ongoing pandemic agreement conversations. I know some of you have been tracking those conversations in Geneva, and I want to thank you and your staff for continuing to do so. The U.S. remains committed to finalizing a pandemic agreement, knowing it's important in filling critical legal and regulatory gaps in this regard. But I also want to acknowledge that we were able to accomplish and finalize negotiations on the international health regulations and amendments to those. And so kudos to everyone here who did that important hard work. And we are looking forward to implementing those amendments in the coming months and years. Finally, none of this would be possible or productive unless we truly centered those who are often left behind and included the voices of the historically underserved, marginalized, and adversely affected by persistent inequalities. Whether women, people of color, indigenous peoples, LGBTQI plus populations, all of these individuals and communities need to be part of any response or services, but also a part of any planning or decision making. And I also want to applaud many of the member states in this room who truly work to center these groups and shine a light on the costs of systemic racism, persistent poverty, and other disparities. I see Minister Nicia here from Brazil noting that this is something that they are highlighting as part of their G20 conversations as well. So just coming to a close here shortly, thank you to PAHO again for convening us, and in particular for the discussions and consultations around your forthcoming strategic plan that was noted from 2026 to 2031. It's our belief that this will advance the priorities that I've already outlined and also help us focus on important innovations in this space, innovations that will work to advance and improve healthcare systems and have the workforce and other requirements that we need to advance this work. We, in particular, welcome the discussions on tobacco control, emergency care, climate change, misinformation, and other critically important issues to advancing our work. And finally, as Director Barbosa did himself, we very much stand with those affected by natural disasters, including those in our country who have been affected by the recent hurricane. We cannot have more examples of how critical it is for health to align our work with climate change and disaster preparedness and response. And so any conversations that we can continue to have, not only regarding preparation, but adaptation and resilience, will also be critically important. Entonces, bienvenidos a Washington.
Welcome, therefore, to Washington, D.C. I'm sorry about the rain you will see this week, but I hope that we'll have a good meeting this week, and thank you very much.
Ahora le concedo.
I now call on the Secretary General of the Organization of American States, Mr. Luis Almagro.
Gracias, señor presidente.
Thank you, Mr. President. It's a pleasure to see you, dear Mr. Jarvas, ministers, friends. It's a pleasure to join you today at the beginning of these very important days of the meetings of the Directing Council of Pan American Health Organization. As the OAS, we join the PAHO in our vision for health as a right that should be guaranteed to all persons in all dimensions of it. Health, like any other, is a public right. It is a right that maintains a social texture. It maintains the operations of any structure, be it political or social. It's a right that should be granted to everyone. It's a public, and that public order was seen very clearly during the pandemic. We highly value, and we thank Mr. Jarvas for his professionalism, his willingness to work hard always, his commitment to ensure that there is continuous cooperation between our organizations. Your presence, Mr. Jarvas, in providing a quick response to the concerns of our organization are deeply appreciated. The complex reality provided by the pandemic of COVID-19 acknowledges that not only was our hemisphere affected by the contagion and loss of lives, but the countries of the Americas had to face, as never before, the structural problems that we encounter: inequality and growing poverty. That has been stated in the Pan American health organizations that have talked about the impact of the pandemic and other social indicators, such as the rates of vaccination, the recent outbreaks of epidemiological cases that affect us as a result of climate change and natural disasters, which particularly have affected the Caribbean and Latin America. We have to protect those populations in our hemisphere that are disproportionately exposed to these factors. We also cannot forget the experience and learning we did in the last few years in the areas of mental health, the so-called quiet or silent pandemic, which occurred parallel to the coronavirus pandemic. In the last few years at the OAS, we've worked together with you in the area of mental health in our region. We have celebrated the High-Level Commission on Mental Health and COVID-19, and we adopted the strategies to deal with mental health and prevent suicide in this region of the Americas. I'd like to underscore that the member states of the OAS have acknowledged the obligation to ensure that policies and services pertaining to public health and mental health are part of the human rights at the international level. Right now, we have made some progress where I would like to reiterate that we will continue to work together in this field. Recently, through the Secretariat of Rights and Equality, we're working together with Pan American Health Organization to prepare the first regional report on human rights and mental health in the Americas. I'd like to conclude by wishing you great teamwork and success at the meeting today. Thank you.
Ahora le concedo el uso.
And now I would like to yield the floor to Mr. Pablo Ibarrarán, Chief of the Social Protection Division of the Inter-American Development Bank. Thank you very much, Mr. President, distinguished ministers, distinguished members sitting at the head table, distinguished colleagues from the Pan American Health Organization, health officials, and all colleagues and friends. It is for me a great honor to address this august assembly on behalf of the Inter-American Development Bank and its President, Dylan Goldfein, who regrets not being able to be with you today, but he sends his most cordial greetings. I will start off by thanking Dr. Jarvas Barbosa for his leadership and continuous willingness to delve into the cooperation between our institutions in order to provide the more effective support to the countries in the region. In April, Dr. Barbosa and President Goldfein signed a letter of intent between PAHO and the IDB, highlighting 3 joint areas of action in order to improve health systems in the region. The first one of these is digital health. For some time now, our institutions have worked together in supporting countries in the design and implementation of digital agendas and roadmaps for digital transformation of health systems, aligned with the regional policies of information systems for health. This cooperation is further deepened today with the Pan American Digital Development Path, a joint initiative included in the Plan of Action for the Health Systems 2024-2030 that has as its main objective to enable health connected for all people in the region, ensuring that they will be able to have access to their health information and share that these irrespective of whether they move to another province, a neighborhood, a country, starting with a digital immunization certificate. Secondly, we cooperate in the strengthening of our primary health care that, as has been said, is the basis for resilient systems that will enable countries to move forward towards universal health care, and that will contribute to preparedness before pandemics and to prevent and manage chronic non-communicable diseases. The bank participates in the Alliance for Primary Health Care in the Americas, hand in hand with PAHO and the World Bank, whose action is already materializing in the countries. And it is up to countries at the leadership which leads to the success of this partnership. The third area of cooperation is preparedness before pandemics. This year, the IDB and PAHO have supported several countries in developing investment projects to be presented to the pandemic fund, whose results will be announced by mid-October. And we work together under the leadership of the countries in preparing investment plans in order to improve preparedness of health systems when confronted with these events. The agenda of the Directing Council that starts today brings these issues and other crucial items such as climate change, mental health, increasing the production capacity of supplies, medicines, and others in the region. These will be very fruitful days for the development of our region. And from the IDB, we hope to continue contributing jointly to this objective. Thank you.
El doctor Tedros
Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, will not be able to be with us in person. However, he will connect through a video call to address the Council this morning. Please allow me to invite you to listen to Dr. Tedros.
Honorable Minister Fernando Boyd Galindo, my brother Regional Director Dr. Jarbas Barbosa, Honorable Ministers and Heads of Delegation, Excellencies, dear colleagues and friends. Buenos dias, bonjour, bon dia, and good morning. I apologize that I cannot be with you in person this morning. Let me begin by expressing deep condolences to the United States of America and the families of those who lost loved ones to Hurricane Helene last week. Lois, please convey our messages. This follows the loss of life and destruction that Hurricane Beryl caused so many member states, to many member states in July. Excuse me, there is some technical problem, colleagues. Mr. Chair, I will come back soon.
You can tell Dr. Tedros that he can continue.
You can continue, Dr. Tedros. We are listening to you.
He's muted. Okay. Okay.
Oh, oh.
Unmute.
Please, unmute.
Okay, thank you, Chair. Let me begin by expressing my deep condolences to the United States of America and the families of those who lost loved ones to Hurricane Helene last week. This follows the loss of life and destruction that Hurricane Beryl caused to many member states in July, and Hurricane Lydia last year, as well as wildfires in Canada, Chile, and the United States, floods in the plurinational state of Bolivia and Brazil, and drought in Suriname. As Dr. Barbosa notes in his report, the Americas is one of the most vulnerable regions to climate change, with more frequent and extreme weather events and economies dependent on agriculture and tourism, especially small island states. These disasters are a double whammy for health. They damage health infrastructure at the same time as putting a huge burden on health systems. They are another reminder that the climate crisis is a health crisis. So I'm pleased to note that at this year's regional committee, you will consider a policy for strengthening equity-oriented health sector action on climate change and health. As you know, climate change is also driving the spread of infectious diseases, including avian influenza, cholera, dengue, yellow fever, and more. This compounds other emergencies, such as the humanitarian crisis in Haiti, which has been overshadowed by the many other crises in our world and is not getting the attention it deserves. But WHO and PAHO have not forgotten Haiti, and we will continue to work with our partners and the government to support the health system and the people it serves. But what the people of Haiti need most of all, like the people of Gaza, Israel, Lebanon, and Sudan, is peace and stability. Detecting and responding to health emergencies depends on strong early warning systems, which is also on your agenda this week. This is one of the key lessons from the COVID-19 pandemic, which is why we established the WHO Hub for Epidemic and Pandemic Intelligence in Berlin. Also based in Europe, the Hub is a global center, and we urge all member states of the Americas to work closely with the Hub to strengthen your own national and regional health security and to contribute to global preparedness and response. As you know, member states made significant steps toward strengthening health emergency preparedness, prevention, and response at this year's World Health Assembly. The adoption of a set of amendments to the international health regulations and the agreement to conclude negotiations of the WHO pandemic agreement before next year's assembly or sooner are major achievements. Although member states have made progress on the pandemic agreement, some of the most crucial issues remain unresolved. I urge all member states to continue listening to each other within the region and beyond, to continue to seek common ground and to conclude a strong agreement by the end of this year, if possible. And it's in your shared interest to do so. And it's possible. Two key features of the pandemic agreement are equitable access to medical countermeasures and the importance of a One Health approach. The same features that are also central to one of the other most pressing health threats of our time, the threat of antimicrobial resistance. As Dr. Barbosa notes in his report, AMR has been a focus for the region for more than 2 decades. At the high-level meeting on AMR at the UN General Assembly last week, World leaders approved a strong political declaration with concrete targets and commitments, as Lois indicated earlier. I would particularly like to thank Her Excellency Prime Minister Mia Mottley of Barbados for her leadership of the Global Leaders Group on Antimicrobial Resistance, and Ambassador Francois Jackman of Barbados for co-leading negotiations on the declaration with his counterpart from Malta. The declaration includes strong commitments to slow the spread of AMR, to reduce the deaths it causes, and to spur the development of new antimicrobial medicines. I urge all member states to take immediate action on those commitments. Addressing AMR is vital for addressing the threat of sepsis, and I welcome the strategy and plan of action on sepsis that you will consider this week. I also welcome the other items this week on integrated emergency, critical and operative care, strengthening essential public health functions, health information systems, long-term care, tobacco control, and more. All of these priorities are well aligned with those of the 14th General Program of Work, which all WHO member states adopted at this year's World Health Assembly. GPW 14 incorporates lessons from the past, the realities of the present, and our aspirations for the future. It's based on a clear mission to promote, provide, and protect health and well-being for all people in all countries, and to save 40 million lives over the next 4 years. To support the implementation of GPW 14, we have launched the first WHO investment round, which aims to mobilize the sustainable and predictable resources we need to do our work. I thank member states from the Americas for the leadership you have demonstrated in advocating for sustainable financing for WHO and for the investment round. We look forward to your participation at tomorrow's investment round event. Every member state can contribute something within its means, and every contribution makes a difference, whatever the amount. At the G20 Leaders Summit in Brazil in November, His Excellency President Lula da Silva will announce the results of the investment round. I thank President Lula for his support, as well as the co-chairs and the many countries which have already pledged, and I ask all countries to join them. The investment round, GPW 14, and the pandemic agreement are all outcomes of the WHO transformation, which we began in 2018 with a mission to make WHO more efficient, effective, accountable, transparent, and results-oriented. Based on ideas from member states, partners, and our own staff, the transformation is the most ambitious set of reforms in WHO's history, with more than 50 initiatives. We have made significant changes to our business processes, our operating model, our approach to partnerships, our culture, and more. And we're not done. One of our key priorities now is strengthening our country offices, as Dr. Barbosa indicated. Together with Dr. Barbosa and the other regional directors, I'm committed to consolidating the transformation and building the organization into WHO of the world needs and deserves. Excellencies, dear colleagues and friends, I leave you with 3 requests. First, I urge all member states to engage actively in negotiations for the pandemic agreement and to complete it before the end of this year. Second, I urge all member states to implement the 14th General Program of Work. And third, I urge all member states and partners to participate in the WHO investment round. Thank you all once again for your commitment to promoting, providing, and protecting health for all the people of the Americas. Muchas gracias, merci beaucoup, obrigado, and I thank you. Back to you, Chair.
Agradezco a los oradores.
I would like to thank the speakers for their statements. And now I formally declared opened the 61st Directing Council of the Pan American Health Organization, as well as the 76th session of the Regional Committee of WHO for the Americas. It is now formally opened.
Voy a conceder un receso de
We will have a 2-minute break while we bid farewell to our guests from the head table.
Muchas gracias.
Continuando con la agenda,
Moving on,
le concedo la palabra
I now yield the floor to the Secretary, Dr. Miguel Bournier, to report to the Council on the statutory provisions concerning this item.
Senhor Presidente,
Thank you very much, Mr. President.
one of the rules of procedure reads, a committee on credentials consisting of 3 members or associate members shall be appointed by the Council at the beginning of the first meeting. This committee shall examine the credentials of the delegates, of members and associate members, and representatives of observer states, and report to the Council thereon without delay. Thank you, Mr. President.
informa al Consejo
I would like to report to Council that by agreement reached at the heads of delegation meeting this morning, we have Canada, Ecuador, and Jamaica who've been nominated to the Committee on Credentials. Should there be no objections, I declare Canada, Ecuador, and Jamaica elected, and I invite a delegate from each of these 3 countries to meet during the coffee break this morning in room 712, located on the 7th floor, to examine the credentials received and report to the Council without delay. I would like to inform the plenary that the Committee on Credentials will report to the Council after the lunch break. The Office of the Legal Counsel will provide the support in the deliberations of the committee. General announcements. I would like to invite now the Secretary to make some announcements of a general nature. Thank you very much, Mr. President.
And so please bear with me. In accordance with Rule 58 of the Rules of Procedure of the Directing Council, The working language shall be those of the members of the Council. Therefore, interpretation is being provided in English, French, Portuguese, and Spanish. Delegates are asked to give their name and country each time they take the floor. This will facilitate the official record keeping of the interventions. Member states, participating states, and associate members will be recognized before observer states, intergovernmental organizations, and non-state actors in official relations with PAHO and WHO. As usual, all members are asked to limit their interventions to 3 minutes. A time tracking system will be displayed on the screen to help delegates keep track of time during the interventions. Instructions for the use of the microphone system are as follows. In front of you, you see the screen. To request the floor, press the silver button on the microphone base. The green light will light up to indicate that your request has been registered. Please note that pushing the silver button a second time will result in your request being deleted from the queue and your place on a speaker list will be lost. To speak, the President will recognize your request and the red light will light up to indicate that your microphone has been activated. Your microphone will be live as long as the ring on the microphone is red. When you finish speaking, please press the silver button again to disconnect the microphone. We would like to remind the delegates to send their interventions to the email interventions@paho.org. This will help the presentation of the final report of the session. Please ensure that each intervention includes the name of your country, the item written in full, along with its corresponding agenda item number. Access to documents, daily programs, and updates during the session of the Directing Council is available on the PAHO webpage and through the PAHO Governing Bodies app. You can download the app to your laptop or smartphone. We encourage you to use it. Each delegation has been provided with an iPad. The documents and presentations for the sessions of the Directing Council have been uploaded onto this iPad. Any updates will also be uploaded directly onto the iPads. Access to the proposed resolutions during the session of the Directing Council is available at rts.paho.org, this website, or in the Governing Bodies app. The credentials for delegates to access the sites are available on the table monitors or can be requested to the Secretariat. In addition to the items on the agenda, we will have 5 briefing sessions from Monday through Wednesday during the lunch break or right after the afternoon sessions accordingly. Information for each session can be found in the programs of meetings. Today, right after the end of the morning session, we will gather in the patio for the official photo of the 61st Directing Council. This evening at 6 p.m., our director will host a reception in honor of the participants of the Directing Council. This reception will take place in the patio on the ground level. Thank you, Mr. President.
Invito a los delegados
I now invite all delegates to take a 20-minute break. We shall meet again at 10:50. We will reconvene at 10:50. Coffee is being served in the patio.
because they left them.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Since 2021, the Pan American Health Organization, PAHO,
has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud, La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só uso o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como Oficina de País en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la región para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones es que son un mecanismo que permite al país que la solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those because that will put the programs in a much better position in the future.
O programa de imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19 and the initiatives to improve routine immunization coverage as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country and they've made tremendous progress, and one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those, as well as some improvements related to cold chain vaccine stock management and infrastructure as well.
Lo que un país que acepta una evaluación está mostrando es que tiene capacidad autocrítica, que acepta ayuda externa, que no se queda con la única verdad que es la de ellos y que está dispuesta a seguir creciendo consiguiendo más información. Creo que los programas de inmunización tienen que convencer a sus autoridades de la importancia de mantener el intercambio con otros países y las evaluaciones.
Todavía hay mucho trabajo. Yo creo que la recuperación se está viendo, pero jamás podemos dar por sentado que eso se va a convertir en algo automático. Creo que en esta última milla para llegar a ese 95% donde todavía tenemos que emplearnos más, concentrarnos más, y por eso es que este tipo de ejercicios de evaluación, de ver cómo está el desempeño del programa de inmunizaciones, cobran una vital importancia, porque te permite justamente, o les permite a los países saber dónde está esa parte que le está apretando el zapato y cómo justamente salir adelante. Entonces, por eso es que son tan importantes ese tipo de ejercicios.
Brasil ha identificado muchas oportunidades de mejora que ya está implementando a través de este proceso. Brasil está demostrando que sí puede, que su política de salud en el Sistema Único de Salud con el programa de inmunización es una realidad para todos los brasileños y las personas que llegan a Brasil, sus fronteras y sus 5.570 municipios comprometidos con la salud de los brasileños y las brasileñas.
Los espacios subregionales son una oportunidad única para la cooperación entre países como una modalidad para la reducción de desigualdades y mejorar las condiciones de salud de sus poblaciones. Así, de esta manera, desde hace varios años, la organización puso en práctica la iniciativa de cooperación Sur-Sur para el desarrollo en salud, mejor conocido como CCHD. Y por medio de esta iniciativa, en el año 2023 se pusieron fondos semillas para financiar el proyecto de cooperación Sur-Sur para la detección temprana del cáncer infantil en los países andinos. Esto en una estrecha colaboración con el convenio Hipólito Unanue, el Horas-CONU.
Dentro de los logros más importantes, tenemos la elaboración conjunta y aprobación por los ministros de salud andinos de la hoja de ruta para mejorar la atención del cáncer en niños, niñas y adolescentes en la subregión andina al 2030.
Este proyecto de cooperación Sur-Sur, que incluyó el intercambio de conocimientos y experiencias entre los países de toda la región andina, ha contribuido a la creación de una política subregional, de diferentes estrategias y planes nacionales que abordan de una manera muy objetiva, muy clara y muy directa lo que es la detección y el diagnóstico temprano de cáncer infantil en todos estos países de la subregión.
Lo más importante es que existe una agenda común interinstitucional que permite sumar conocimientos y experiencias en pro de la niñez y la adolescencia, generando un impacto positivo significativo en la atención del cáncer infantil.
El video que vemos ahora nos presenta de una manera muy clara, con testimonios muy sentidos, con una muestra muy definitiva del beneficio que tiene la cooperación Sur-Sur para el desarrollo en salud.
Los niños son de interés superior. Los niños, desde la Convención Marco de Naciones Unidas de Derechos Humanos de Infancia y Adolescencia, son de interés prioritario y su salud también. Y por eso salvar una vida de un niño es fundamental para los gobiernos y para todos los actores.
En estos momentos en La Guajira, pues tenemos varias dificultades en el acceso a la salud en las comunidades indígenas, ya que muchas de estas comunidades son comunidades dispersas, que no se encuentran muy cerca al área urbana. Entonces, esa es la primera dificultad, el acceso y las barreras que se presentan para esas comunidades para obtener un servicio de salud. Y todos los determinantes que puedan disminuir la incidencia de esas enfermedades que están afectando a la población, principalmente indígena, como es el cáncer infantil.
Cuando yo llegué a la clínica me hicieron exámenes, me hicieron radiografía, todo eso, y después me salió que yo tenía una masa. Y después ya descubrieron que es lo que yo tenía. Tenía leucemia y fibroblástica aguda. Es de esa maligna.
En ese momento cuando me dieron la noticia, eso fue duro, porque no me imaginé de que ella iba a tener eso, porque ella era una peladita sana, no tenía nada.
La OPS, desde la iniciativa de mejor atención para las enfermedades no transmisibles como el cáncer, busca fortalecer las competencias, el conocimiento de los equipos de atención primaria, y es en el marco de este enfoque de equidad, de lograr justamente afectación de los determinantes sociales, que se logra este proyecto de cooperación para fortalecer las competencias, el conocimiento de estas enfermedades del cáncer infantil en niños y adolescentes, tanto en profesionales de la salud, médicos, enfermeras y otros profesionales, asimismo también en gestores comunitarios y en toda la red de apoyo social y administrativo que se requiere para lograr un tratamiento de oportunidad, detección oportuna y también de calidad.
Para La Guajira tenemos una población bastante dispersa, una población
con unos determinantes sociales muy críticos, en donde definitivamente tenemos que entrar a capacitar al personal que está cerca de esas comunidades, a los mismos líderes comunitarios, para que aprendan a identificar de manera temprana el cáncer infantil y así poder hacer un tratamiento rápido. Tenemos que fortalecer las redes de atención específicas para el manejo de esos pacientes.
Todavía hay pacientes que mueren por causas que pueden ser evitables. Por eso estamos acá, porque hacer los cursos de detección temprana le damos herramientas a los médicos para que ellos puedan detectarlo tempranamente, hacer un tratamiento oportuno y evitar así la muerte temprana en nuestros pacientes.
Hace poquito me dijeron que la masita que ella tiene se está reduciendo al 75%. Ha reducido mucho.
Dejo que lo cuiden mucho porque está dando mucho la leucemia y el cáncer. Y obsérvalos, no deje de observarlo.
Y aunque sea un niño, yo soy un vencedor. Yo vivo feliz porque tengo a Dios. Y aunque sea un niño, yo soy.
Ella le preguntan que se quiere ser y ella dice, no, yo quiero ser doctora.
If the delegates can take the seat so we can start the session, I appreciate. Por favor, si se pueden tomar los asientos, así podemos comenzar la sesión. Gracias.
Señores delegados,
distinguished delegates, the next item is the election of officers. I would like to call on the Secretary to report to the Directing Council on the rules and regulations pertaining to this item. Mr. Secretary?
Muchas gracias, señor presidente.
Thank you, Mr. Chair.
Procedures state, the Council shall elect a member or an associate member to the presidency, the 2 vice presidencies, and the office of the rapporteur, respectively. They shall hold office until their successors are elected. Each elected member or associate member shall designate a person on its delegation to serve in that office for the duration of the session. Thank you, Mr. President.
informo al Consejo que
I would like to report to the Council that as a result of the agreement reached by the heads of delegation meeting this morning, they have proposed to Paraguay to chair the meeting. If there's no objection, I declare Paraguay elected by acclamation to occupy the chair, and I invite Director Maria Teresa Barán Cuachuc, Minister of Health of Paraguay, to come to the head table to take on the chair.
Distinguidas autoridades, colegas, delegados y amigos.
Distinguished colleagues, delegates, and friends, it's an honor and privilege for me, on behalf of the government of Paraguay, to assume the chairmanship of the 61st meeting of the Directing Council of the Pan American Health Organization and the meeting of the Regional Committee of the World Health Organization. I thank you for the trust placed in my country to lead this session of great importance at a crucial time for public health in our region. In exercising this chairmanship, I would like to reiterate my willingness to work with each and every one of you to try to find innovative and sustainable solutions with the firm intention of improving the quality of life of our peoples and ensure equitable access to health. Thank you again for bestowing this honor on me. I am quite sure that together we will move forward towards a more healthy, resilient, and strong region. I would like to report to the Council that by virtue of the agreement reached at the meeting of heads of delegation this morning, Bahamas and El Salvador have been proposed for the vice presidency. If there is no objection, I declare Bahamas and El Salvador elected by acclamation to occupy the two vice presidencies of the Directing Council. I now would like to inform the Council that by virtue of the agreement reached at the meeting of heads of delegation, Honduras has been nominated to serve as rapporteur. If there is no objection, I declare Honduras elected by acclamation, and I invite Dr. Carla Paredes Reyes, Minister of Health of Honduras, to take her place at the head table.
Lee esto. Y después consideramos el nuevo punto, ¿ok? Sí. Ok, pero espero que esté sentada ella ahí. Muy bien, ahora puede seguir ahora. Puede seguir.
Informo al Consejo que no hay necesidad de aprobar un...
I would like to inform the Council that there's no need to approve a resolution on this item. The appointments will appear as a decision in the final report.
Paso a considerar el siguiente punto.
We will now move on to the next item. I'd like to ask the Secretary to inform the Council on item 2.3, the establishment of a working group to study the application of Article 6.b of the Constitution of the Pan American Health Organization. And I'd like to invite the Secretary to report on the Council on the regulatory provisions of this item. Thank you, Madam Chair.
Of the PAHO Constitution provides that if a government fails to meet its financial obligations to the organization by the date of the opening of the Pan American Sanitary Conference or a meeting of the Directing Council, by being in arrears in an amount exceeding the sum of its annual payments of contributions for 2 full years, the voting privileges of that government shall be suspended. Nevertheless, if the conference or the Directing Council is satisfied that the failure of the government to pay is due to conditions beyond its control, it may permit the government to vote. Traditionally, it has been the practice of the Directing Council to appoint a working party made up of delegates of 3 member states to study the application of the article. Thank you, Madam President.
Informo al Consejo.
I'd like to report to the Council that by virtue of the agreement reached at the meeting of heads of delegation this morning, Barbados, Panama, and Uruguay have been nominated to this working group. If there is no objection, I declare Barbados, Panama, and Uruguay elected to the working group, and I request that the group meet this afternoon in room 712 during the coffee break. The working group will be provided support by the office.
Informo al Consejo que los nombramientos.
I'd like to report to the Council that the nominations will appear in the final report as a decision. I now move on to the next item for consideration, item 2.4, the establishment of the General Committee. I'd like to ask the Secretary to report on the statutory provisions concerning this item. Thank you, Madam Chair.
Rule 32 of the Rules of Procedure states, the Council shall establish a General Committee consisting of the President of the Council, the 2 Vice Presidents, the Rapporteur, and 3 delegates elected by the Council from among those members or associate members not already represented on the General Committee. The President of the Council shall serve as President of the General Committee. Thank you, Madam President.
Informo al Consejo.
I would like to inform the Council that by virtue of the agreement reached at the heads of delegation meeting this morning, the following 3 members have been nominated to accompany the members who hold the presidency, the 2 vice presidencies, and the position of rapporteur to make up the General Committee: Cuba, St. Kitts and Nevis, United States of America. If there are no objections, I declare Cuba, St. Kitts and Nevis, and the United States of America elected. The General Committee will meet today during the lunch break, right after the official photo, in room 712 on the 7th floor. I also would like to inform the Council that there is no need to adopt a resolution on this item. The appointments will appear as a decision in the final report. Let us move on to the next item. Item 2.5, adoption of the agenda. I would like to draw the council's attention to document CD 61/1 and call on the secretary to present the statutory provisions concerning this item.
Señora Presidenta, Rules 10 of the Rules of Procedure state, the Council shall adopt its own agenda and, in doing so, may make such additions or modifications to the provisional agenda as it may wish in accordance with these rules and as recommended by the General Committee. End of quote. In accordance with Rule 10 of the Rules of Procedure, a provisional agenda, that is document CD 61/1, as approved by the Executive Committee, was distributed to each of the members, participating states, associate members, and observer states of the organization. It is now incumbent on the Council under Rule 10 of its Rules of Procedure to adopt its own agenda. Thank you, Madam President.
Ahora,
I now open the floor to the plenary to begin the discussions.
cedo la palabra a Brasil.
I call on Brazil.
We will speak in Portuguese.
We're very grateful to the Secretariat of the Pan American Health Organization for submitting the annual report. And I also agree to Dr. Chavez Barbosa for his excellent work at the helm of this organization. We're very pleased to see the work that has been done, especially with the focus on expanding the ability to expand and improve medicines, vaccines, and other inputs such that we can ensure the sufficiency or sufficient supplies in the Americas. This expansion is one of our main proposals within the context of the G20, that is, under health, as a part of the world progress against inequality, hunger, and poverty. Now, at the UNGA, President Lula stated that we have to learn from the pandemic and to effectively strengthen multilateralism, which is necessary for us to include the aspirations and the capabilities of the global South. It's from this stance that addressing epidemics is very important for us to have an early and timely response to health emergencies, thereby avoiding epidemic outbreaks from becoming devastating pandemics. That's why we approve the strategy of the epidemic intelligence of the Americas to strengthen early response to health emergencies. Brazil has faced impacts resulting from climate change, underscoring the fires in the Pantanal and the Savannah region in Brazil and the floods in the south. Climate change has an impact on health, and that's why it's one of the priority topics of the President of Brazil at the helm of the G20. We just launched a few months ago a program to tackle dengue outbreaks, which is another sign of the very serious impact of climate change. We need to have regional cooperation and come up with a regional strategy for us to tackle these challenges. Approving the resolution on climate and health at this directing council is going to be a very important step in that direction. This year, in the summer, we hosted, along with PAHO, a regional agreement addressing inequalities, racial and ethnic inequalities, including 22 member countries. This was a regional meeting in which we identified the need for us to speed up the implementation of the PAHO Plan of Action on Health and Ethnicity, which we will be addressing here. Now, in line with the campaign Zero Maternal Deaths that we launched in Brazil, with reference to obstetric violence that took place in 2022 against a black woman, in which the state of Brazil was condemned. And this has prompted us to fight against or to bring down the deaths, maternal deaths. Now, also, communicable diseases, which is an initiative that Dr. Barba referred to by striving to eliminate filariasis. We have also been focusing on other socially harmful diseases, such as tuberculosis. Now, in the area of non-communicable diseases, I would like to underscore the national policy of diagnosis and treatment of cancers, which is one of the pillars of the recently launched greater access to specialists, reducing wait times with a focus on speeding up diagnostics and treatment. Promoting mental health also warrants our attention, as was mentioned at the opening of this very important meeting. That is a huge challenge for all societies that face problems such as isolation and the impact of digital technology on people's mental health, and also primary health care in the Americas. And the policy for the 2030 labor health. In December of this year, we are going to host the conference for health workers management. We are active participants in digital transformation, which is going to be on our agenda. And to this effect, the Health Ministry created a new secretariat focused on this very important agenda. Now, when we speak of health policy, generally speaking, we refer to the actions taken by national states, by countries, but it's absolutely necessary for there to be social oversight of these efforts. In Brazil, this we have as background the creation of our single healthcare system, SUS, and that is why we are we create the social participation for to ensure universal coverage at the World Health Assembly. Now, taking together all these different initiatives, PAHO stands out in its leadership in the region of the Americas. And here I would like to underscore the convergence with the administration headed up by President Lula and the health ministers. The key word here is equity. It's always a good idea to remember that inequality is bad for one's health. Now, we reassert Brazil's commitment to the successful conclusion of negotiations around the agreement focused on pandemics, because more than ever before, we need a robust system of multilateral coordination to tackle public health emergencies. Thank you very much. And hopefully we will continue to strengthen cooperation in the region of the Americas.
Les recuerdo que punto
Muchas gracias, señora presidenta. Como presidenta del Comité Ejecutivo, me complace presentar el informe sobre las actividades llevadas a cabo septiembre del 2023 y septiembre del 2024. Durante ese periodo, el comité celebró las sesiones 173ª y 174ª y el subcomité celebró su 18ª sesión. En esta oportunidad informaré solo sobre los puntos examinados por el comité ejecutivo que no se encuentran en el orden del día del Consejo Directivo. Muchas gracias, señora presidenta.
Thank you very much, Madam Chair. As President of the Executive Committee, I'm very pleased to present the report on the activities carried out by the committee and the subcommittee of Program, Budget, and Administration between September of 2023 and September 2024. During that period, the committee held its 174th sessions, and the subcommittee held its 18th session. Currently, I will only report on those items that were under examination by the Executive Committee that are not also on the agenda of this Directing Council. I will report on the other items as they are addressed by the Council. During the period in question, the members of the committee were Argentina, the plurinational state of Bolivia, Canada, Chile, Ecuador, the U.S., Guyana, Jamaica, and Uruguay. The Executive Committee held its 173rd session on September 29, 2023, immediately following the 60th Directing Council. My country, Uruguay, was elected to serve as President of the Executive Committee for the period from September 2023 to September 2024. The United States of America was elected Vice President, and Chile was elected as Rapporteur. During its 173rd session, the committee elected Ecuador to serve as the subcommittee on Program, Budget, and Administration, and appointed the members of the Award Committee for PAHO Award for Health Services, Management, and Leadership for 2024. The committee also set the dates for the sessions of the governing bodies in 2024 and agreed on topics to be discussed during the year. During the same session, the committee received updated information on the Master Capital Investment Fund and the renovations underway at the PAHO headquarters building. The committee held its 174th session from 24th to the 27th of June of this year. During the session, the committee heard a report on the 18th session of the Subcommittee on Program, Budget, and Administration, which was held in March. All of the administrative, financial, programmatic, and personnel matters discussed by the subcommittee at its 18th session were subsequently discussed by the Executive Committee. A number of them are also on the agenda of this Directing Council. Details may be found in the final report of the subcommittee's 18th session, document SPBA 18FR. Among other actions taken during the June session, the Executive Committee decided to approve the admission of 7 non-agent actors into official relations with PAHO and the continuation of official relations between PAHO and the 9 non-state actors. By recommendation of the Bureau, the committee deferred a decision on the continuation of official relations with the non-state actors to allow that organization additional time to draw up a robust plan of collaboration. The committee also appointed a member of the PAHO Audit Committee In addition, the committee examined the annual reports of the Ethics Office, the Investigations Office, the Audit Committee, and the Office of Internal Audit for 2023. Under Administrative and Financial Matters, the committee received an update of the status of the Master Capital Investment Fund and its various sub-funds. Under Personnel Matters, the committee heard a report on the Bureau's human resources and received an update on the Bureau's efforts to prevent and respond to sexual harassment, exploitation, and abuse. As is customary, the Executive Committee also heard a statement by a representative of the PAHO WHO Staff Association. At its 174th session, the Executive Committee adopted 16 resolutions and 2 decisions, which appear, together with a summary of the presentations and discussions on each item, in the final report of the session, document CE 174-FR. This concludes this portion of the report, Madam President. As I said earlier, I will be reporting on the other items considered by the Executive Committee as they are taken up by the Directing Council. Thank you very much. Now I invite the Directing Council to take note of the report and to take note of the germane topics, and I open the floor for the debate.
Señor Director.
Mr. Director, would you like to make some remark? Thank you very much, Madam President, and also the Executive Committee. I have a brief remark I would like to make just by way of expressing thanks for the work carried out by the new 9 members of the Executive Committee, and in the meeting held in June at the headquarters here that prepared much of what we are going to be addressing at this meeting, making contributions that, without a doubt, will enrich our discussions. I'm also very grateful and offer special greetings to the members of the Executive Committee for the contribution that they made. Argentina, Bolivia, Jamaica, thank you very much.
Gracias, señora Presidente.
I thank the President of the Executive Committee for his report and the members of the Executive Committee for their invaluable work, and inform the Council that the discussions will be noted in the final report. Now, the next item. 3.2, Annual Report of the Director of the Pan American Sanitary Bureau. I would like to bring the official document 371 to the attention of the Council, and I invite the Director of the Pan American Sanitary Bureau, Dr. Jarbas Barbosa, to present this annual report.
Gracias, señora Presidenta.
Thank you, Madam President, delegates, ambassadors, and colleagues across the Americas.
Address this audience today and to share our annual report, which is effective to cover a full year under my tenure as director of this organization. I want to start by thanking all member states and you for the trust placed in me for the opportunity to serve the people of our region. It's a true honor. This report takes us forward to how the Secretariat has taken the opportunity to focus its efforts with member states on seizing the significant opportunities presented by the COVID-19 pandemic for advancing substantial positive transformation, regaining health advances, and improving equity to health for all. Pandemic lessons, particularly those that had to speak to deeper structural issues and neglect determinants of health, guided the strategic approaches to identifying those who are most vulnerable and addressing barriers to access to health. These are challenges that we must acknowledge, learn from, and be prepared to face again. In spite of them, I am happy to state unequivocally, we have made progress. The report on the activities of the Pan American Sanitary Bureau reflects the progress achieved on many fronts. The document provides a comprehensive account of how this organization has touched on every health priority of this region by being a close partner and source of technical cooperation to all countries in the Americas. To represent our broad scope, I would like to highlight only some key initiatives we launched or enhanced in this period covered by the report. These initiatives carry the potential to transform health in the Americas. The first is our disease elimination initiative, which has been refreshed and prioritized under my tenure. Our goal is to dramatically accelerate progress towards eliminating 30 diseases and conditions over the next 5 years. This is an achievable goal. We have the tools and the knowledge required that we can only reach with ambition and coordination. Take cervical cancer or vertical transmission of HIV. The path is clear as long as we work together towards it. El Salvador, Brazil, Colombia, and El Salvador have launched the national elimination strategies aligned with our initiative, and Bolivia, Chile, Guyana, and other countries are developing roadmaps for elimination. We launched a year ago the Better Care for Non-Communicable Diseases initiative, putting primary health care as the forefront of the fight against NCDs in our region, addressing key drivers of morbidity such as hypertension, diabetes, asthma, and improving cancer screening. This program is grounded in our conviction that primary health care is the backbone of a resilient health system and the best entry point for timely care. This program is empowering and equipping primary health care staff to meet the shifting epidemiological burden in our region. To date, 30 countries in Latin America and the Caribbean have committed to implementing HEARTS. In fact, 80 countries are already implementing the program throughout their primary health care network. By the end of June 2024, 6,500 primary health care facilities covering approximately 34 million adults were implementing HEARTS. The program has 4.4 million people under treatment, of which 62% reach the best standard of care. Indeed, if the Americas improve the population-based hypertension control from the current level of only 36% to a target of 50%, over 400,000 CVD deaths could be avoided. Furthermore, if CVD secondary prevention efforts were expanded, many more deaths could be averted. The digital transformation of the health sector in the Americas offers an unprecedented opportunity to bridge the gap between health services and underserved populations. But it takes a concerted effort to ensure we use these tools to overcome access disparities. At PAHO, we are actively collaborating across sectors in every country to ensure that digital transformation becomes a driving force to improve health, enhance data, and improve efficiencies within health systems. I am pleased to report that countries have already made significant progress, particularly in key areas such as information systems, telehealth, artificial intelligence, and platforms for ensuring cross-border interoperability, ultimately supporting more equitable and connected health. Let me now switch to Spanish. La pandemia.
The COVID-19 pandemic revealed the structural dependence that Latin America and the Caribbean has on imported health products and those of other health technologies with geographic concentration in capacity and the ability to innovate and to produce, leading to vulnerability in the world supply chain. Now, As a result, in 2021, member states recognized the need to step up our productive capacity for essential medicines technologies in our region. The Special Program for Innovation and the Regional Platform for the Production of Medications and Health Technologies was created to promote the creation of regional ecosystems and initiatives that would strengthen the ability to innovate, develop, and produce health technologies. Very important strides have been gained by way of strengthening capacities for the development and production of vaccines, messenger RNA vaccines in the Americas, such as the creation of a public-private partnership in Argentina, including the Health Ministry, the National Administration of Health Institutes and Laboratories, ANLIS, and the Synergium Biotech Company for the development of vaccine productive capacity for messenger RNA, as well as strategic inputs, as well as in the area of innovation, collaboration between PAHO and the Health Ministry of Brazil, as well as the Biomanguinhos and Fiocruz labs, made strides toward producing a new RNA vaccine that is self-replicating for COVID-19, as well as the biotech Synergium launching a new project aimed at further development of such vaccines against H5N1 avian flu, which is one of the concerning health problems that we have in the region, affecting mammals as well as poultry farms in the United States. Now, as we said this morning, PAHO is engaged in negotiations with Pfizer to promote early access to one of the most advanced vaccines produced by Pfizer. This negotiation involves a producer in Latin America, and this initiative is a concrete example of efforts put forward by PAHO through its revolving funds, not only to enhance access of countries to vaccines, but also to ensure the support where it's possible for there to be pluriannual contracts that would bolster the production in our own region, that is, making those funds available for that purpose to ensure sustainability. Now, the revolving funds are a pillar in our region and have been for decades, and they're absolutely essential to ensure the fair prices and steady supply of products for our countries. We are striving to make this even more tailored to the needs of member states through updating how these funds operate and to create incentives to support regional productive capacity. And this is something that we will be addressing further at this meeting. Now, last year, we launched the demand planning program, helping countries to, in real time, have a sense of what their needs are going to be. Now, over the last couple of years, 160 million people benefited from the procurement ability made possible through the revolving funds with the participation of 37 different countries of the Americas. Now, over the last couple of years, countries of the region managed to halt the drop of routine vaccine coverage, including for most antigens, as I said, reaching 88% for the third DPT dose. In a recent report that UNICEF and PAHO, or WHO rather, shared with the whole world, our region is held up as the region that made the greatest progress in enhancing or recovering vaccination coverage after being hit by the COVID pandemic, and we should be proud of that. And we have reduced the number of children that had not yet received any vaccination in our region. We want to be even more ambitious and to forge ahead so that we can achieve the coverage levels that are necessary for us to keep our region free of many diseases. Now, the Zero Maternal Deaths Initiative addresses the unacceptably high mortality rates in our region. This is an effort to overcome the devastating impact of the pandemic. Now, in our region, going back before the pandemic, we had seen a rise in maternal deaths in some of the countries of our region. Now, we have stepped up our training to tackle emergencies in all the priority countries. We have considerably enhanced surveillance of maternal morbidity, and we are working very hard to address the gaps that arise along the way so that we can better protect our women from premature death. Once again, the tools and the knowledge exist, but we are not bringing them to bear as we should to assist the most vulnerable. So we are working with each and every one of the countries, and we'll continue to do so with each and every one of our partners to change that situation as quickly as we can in our region. Now, over the last year, our work has been guided by two guiding principles: our appetite to innovate and a commitment to equity. Strides have been made in transparency, operational efficiency, and accountability with our PAHO Forward program that's based on systematic innovation and modernization of our managerial practices, at the same time that we are cultivating a respectful and inclusive working environment. Now, a number of different policies and procedures have been carried out aimed at streamlining administrative operations. At the same time, we strengthened internal oversight as well as enforcement measures. Equity is our moral compass as we seek out health for all. Innovation also represents the best way to improve the work we do by adopting the best tools and tests that can have the greatest impact. It's with this spirit that PAHO will continue to work with countries and among countries to build greater resilience in our health care systems such that they can truly meet the needs of the people in the Americas. We have made great strides, much progress, but together we can do much more. Thank you very much for your attention.
Muchas gracias, doctora Rosa.
Thank you very much, Dr. Barbosa. Now I invite the Directing Council to take note of the annual report by the Director and to make whatever comments they deem appropriate, and I open the floor to the plenary to begin the discussions.
Concedo la palabra.
I give the floor to Jamaica.
Thank you, Madam Chair. Madam Chair, Jamaica would like to congratulate and commend Dr. Barbosa and the entire PAHO team for the success over the past year and look forward to continued implementation and introduction of new strategies and plans to build resilient health systems and achieve the SDG targets for 2030. Jamaica continues to work with PAHO in building a more robust health emergency preparedness and response program. This capacity has been tested over the last few years on several occasions and has reinforced our ability to maintain essential services and to return to normal functions quickly. Hurricane Beryl has been the latest shock to the system, and despite severe damage to health infrastructure on the south side of the island, we're able to continue essential health services and fully restore all services within a matter of days. Over the last year, Jamaica and the collaboration with PAHO has been able to achieve elimination of mother-to-child transmission of HIV and syphilis. This marks a significant milestone in strengthening maternal and neonatal care and has put us in a better place to achieve the SDG goals for 2030. Another significant area of collaboration has been in the area of immunization. Despite the challenges and disruption caused by the COVID-19 pandemic, Jamaica has been able to maintain and improve on some immunization rates. The supply of vaccines through the PAHO revolving fund and support for capacity building in many areas has contributed to our success. POW has also been an invaluable player in advancing the use of digital technologies in Jamaica. In partnership with the IDB and the World Bank, Jamaica has advanced with health system strengthening project that is piloting an electronic health record system. POW has provided continuous support and oversight, and we continue to build on this capacity. Finally, these are only some of the areas of significant cooperation that I have highlighted. We continue to have a strong relationship with our country office in implementing our 10-year strategic plan. We look forward to continued collaboration and support and to the implementation of new plans, in particular in the areas of antimicrobial resistance, prevention of sepsis, and One Health. We believe that these plans will have a great impact on us achieving a resilient health system. Thank you, Madam Chair.
Thank you. I thank Jamaica. I would ask speakers to read a bit slower to facilitate interpretation. I give the floor to Mexico. Members of the Secretariat and Directing Table, Ministers of Health, distinguished representatives at this Directing Council and Director. I'm pleased to speak to you on behalf of the Government of Mexico and to offer a warm greeting by the President of Mexico, as well as on behalf of the incoming President, Claudia Sheinbaum. Mexico is going through times of change, and tomorrow precisely is when we were going to start our transition toward a new stage of our government. And the transformation of the healthcare system was already started by President López Obrador under the mandate of not leaving anyone behind, not leaving anyone out, putting people front and center, and strengthening primary health care. Under the new administration, we will follow through with that vision of social justice based on rights that will drive Mexico to forge ahead to ensure that the right to health is actually carried out, brought to fruition. Now, within that approach, we recognize the report just offered by Dr. Barbosa, the second of his mandate, which shows the very hard work that this organization has done as a specialized agency on public health for the region of the Americas, always working in favor or at the service of member states. And on that, I would like to recognize the support that this organization has given to our country in the process of transforming our system at the same time that we were addressing the COVID-19 pandemic. We should recognize the joint effort carried out in favor of the region, enabling us, among other things, to host the 11th conference for harmonizing pharmaceutical regulations in last August, which enjoyed the participation of health authorities of 34 different countries of the region. That was the 25th anniversary of the Pan-American Network of Harmonization of Pharmaceutical Regulations, where we were able to take a look at the results and challenges still faced by the region of the Americas to achieve the convergence and regulatory convergence and harmonization, moving toward self-sufficiency. Mexico recognizes that our country has made progress thanks to that solidarity. Now, in the work undertaken by our new administration, we want to reassert our avocation for collaborating with the countries of the Americas to enhance the health of the region and to achieve the Sustainable Development Goals. With the new strategy called Healthy Republic, the priority of the new administration of our country in health will focus on fully availing ourselves of the existing resources and to move toward adopting new technologies such as telemedicine and biomedicine. Prevention through promoting healthy lifestyles and creating partnerships to strengthen innovation in the sector focused on people and communities, which, without a doubt, can be achieved through technical cooperation that is facilitated through POW. Thank you very much. Thank you, Mexico. I give the floor now to Canada.
Madam President, Dr. Barbosa, honorable ministers, distinguished delegates. I would first like to acknowledge that we are gathered on the ancestral lands of the Nacotchtank and Piscataway people. I come with respect for this land that I'm on and for the people who have had and do reside here. In Canada, today we mark Truth and Reconciliation Day. The day was established in response to our country's Truth and Reconciliation Commission and aligns with Orange Shirt Day, a day that commemorates the experience of Indigenous children who attended residential schools. Between 1831 and 1996, over 150,000 Indigenous children attended 140 federally run residential schools in Canada. We likely will never know the exact number of children who attended, as many records were destroyed, and many children never returned home. This day also honors the survivors of residential schools, as well as their families and communities. Indeed, learning from our past to inform a better tomorrow aligns with the Director's annual report, thank you, which illustrates how the pandemic has challenged how we collectively protect and advance health, but that we have a wealth of lessons learned to now seize upon to move ahead critical, innovative opportunities, and for which we applaud PAHO's continued leadership in advancing such efforts in our region. In Canada, a significant response to a domestic COVID lesson learned has been the launch of Health Emergency Readiness Canada, allowing the Canadian government to reaffirm its commitment to strengthening the biomanufacturing and life sciences sector, supporting the development and production of critical medical countermeasures, and engaging with domestic and international partners to ensure Canada is well equipped and prepared to respond to future pandemic health threats. We recognize PAHO's pivotal role in supporting member states and commend the organization's work advanced over the past year, including in reinvigorating immunization efforts seen with its Vaccine Week in the Americas. PAHO's agility from the onset of the pandemic played a key role in protecting the region, and Canada is proud to financially support PAHO's flagship initiatives through its regional platform to improve manufacturing capacities and equitable access to vaccines. However, the disruptive impacts of COVID-19, as we all have said already this morning, continue to ripple across the Americas, with the region not on track to achieve many targets established in the current strategic plan or health-related SDGs. Having embarked on the critical work of developing the new strategic plan for 2026 to 31, we all have a responsibility to reposition PAHO and ourselves in the region to recover past health gains and advance positive health outcomes, while also revitalizing action to advance the SDGs. Strengthening of essential public health functions and data interoperability are critical. The Americas continue to face pronounced inequality, hampering progress on many of the health challenges we face. This week, as we consider and adopt strategies and policies on critical issues, it is incumbent upon us to keep health equity and gender equality at the forefront of discussions. We've all mentioned the important milestones achieved on AMR, including last week, the importance of keeping NCDs at the forefront, and in climate change and health, including episodes of extreme heat. Much work is upon us, including concluding the pandemic agreement and strengthening governance in WHO governing bodies more broadly. Canada will continue to be a trusted partner with you. Thank you.
Gracias, Canadá.
Madam Chair, congratulations on your preferment to office, Director Barbosa, honorable ministers, distinguished officials, delegates, all. Today, as we reflect on the Director's annual report, I'm grateful and honored to acknowledge that PAHO has had a profound impact on Dominica's health landscape over the past year. Our partnership has brought substantial benefits, primarily through the essential support of our in-country advisor for health systems and services. This direct assistance has enhanced our healthcare delivery, notably through crucial antenatal reviews and audits that strengthen maternal and child health initiatives. Together, this collaboration represents a meaningful investment in the well-being of our citizens. Furthermore, in today's challenging global financial landscape, your guidance in securing access to strategic funds for procurement has been invaluable. This support ensures that our health facilities can effectively address our population's needs. The value of life cannot be overstated. It is at the heart of every healthcare endeavor. I want to highlight PAHO's critical support in the implementation of our HEARTS program, in accrediting our healthcare facilities and providing that support, and integrating innovative solutions such as telemedicine. In an era when specialized human resources are in demand, such innovations are vital for maximizing our capabilities and improving access to quality care. As we prepare for revalidation of EMTCT, of HIV, syphilis, and Hep B, we again look forward to working closely with PAHO in maintaining our zero status. Through you, Madam Chair, I extend my heartfelt congratulations to Dr. Barbosa for his exemplary leadership of PAHO. Your initiatives focused on disease elimination, better care for non-communicable diseases, and mental health resonate deeply with our priorities, and we eagerly anticipate the positive outcomes of this vital work. I also commend Dr. Amalia, our PAHO WHO representative, for her unwavering support and contributions towards advancing our shared goals. In closing, let us reaffirm our pledge to this vital partnership between Dominica and PAHO and among our public health agencies and Caribbean health institutions. We have before us a wonderful opportunity to leverage our collective strengths to create powerful synergies to withstand any challenges. By joining forces, we will pave the way for a healthier future for all Dominicans and an exceptional people of our sub-region. With this commitment, I yield the floor to you, Madam Chair, confident and resolved in the belief that together we shall continue to reverse the convulsive death throes that the chains of health disparity thrust on our people as we fulfill our responsibility to save lives, improve living conditions, and access quality health care for all our communities. Once more, congratulations and thank you.
A importância
região amazônica, no bioma do Pantanal e do Cerrado. É muito importante, nesse momento, destacarmos a importância dessa agenda e a aprovação da resolução sobre clima e saúde nessa reunião é um passo importante nesse sentido. Quero também destacar na cooperação do Brasil na região das Américas, liderado pela OPAS, um encontro regional abordando as desigualdades étnico-raciais. É fundamental que demos atenção especial a esse tópico. Em sintonia com a campanha Zero Mortes Maternas, referi-me ao lançamento da rede Aline no Brasil. Quero também destacar aqui nosso intuito de contribuir para essa agenda regional de redução da mortalidade materna, infelizmente, um dos piores indicadores no Brasil e na região das Américas. Ao mesmo tempo, na agenda da saúde infantil, venho solicitar a todos os países da região o apoio para a resolução que proporemos à Organização Mundial da Saúde relacionada ao marketing digital para substitutos do aleitamento materno. Em nosso país, a campanha pelo aleitamento materno é um ponto fundamental, com várias estratégias nesse sentido. O Brasil lançou o programa Brasil Saudável, alinhado com a estratégia da eliminação de doenças transmissíveis como problema de saúde pública. Fico bastante feliz com o resultado alcançado em relação à filariose, mencionada pelo Dr. Jarbas, mas muito teremos que avançar nessa e na agenda para as doenças não transmissíveis, que aqui destaco a política recém-lançada em relação à prevenção e diagnóstico, prevenção e tratamento para cânceres, que é base no Brasil do programa Mais Acesso a Especialistas. Saúdo também a Aliança para a Atenção Primária e ressalto também a política para a força de trabalho em saúde. Creio que são temas que fazem parte também nossa determinação para o alcance dos objetivos da Agenda 2030. Na agenda da gestão do trabalho em saúde, o Brasil realizará em dezembro a Conferência para a Gestão do Trabalho em Saúde e pretendemos contribuir com essa agenda no plano regional, uma agenda sensível há tantos anos em todo o mundo. Da mesma forma, estamos alinhados no esforço da transformação digital, envolvendo tantas ações e também o uso com significado positivo e de maneira sustentável da inteligência artificial, um tópico que merece atenção no relatório e toda a atenção no Brasil. Quero também destacar aqui a importância da participação social e compõe nossa delegação o presidente do Conselho Nacional de Saúde do país. O Brasil, desde a criação do SUS, destaca essa agenda e, por isso, este ano saudamos a resolução da Organização Mundial da Saúde, que inclui participação social para a cobertura universal. Em todas essas iniciativas que têm liderança na OPAS, há uma grande afinidade com o pensamento do governo brasileiro, liderado pelo presidente Lula, e eu creio que vale destacar o tema da equidade como diretriz que acompanha todas essas ações. Como costumo dizer, desigualdade faz mal à saúde e devemos levar a sério essa assertiva. Por fim, gostaria de ressaltar o compromisso do Brasil, e é fundamental estarmos juntos na região com a conclusão exitosa das negociações em prol de um acordo para pandemias. Precisamos aprender essas lições, estar junto, fortalecermos as capacidades locais e regionais e fortalecermos a resiliência e a sustentabilidade dos nossos sistemas de saúde. Contem com o Brasil, estaremos juntos nesse trabalho, no avanço dessa agenda. Muito obrigada.
Muchas gracias, Brasil.
Testing the English channel, testing the English channel.
Oh, you said
Testing 1, 2, testing. This is the English booth.
Buen día, buen día.
Can we test? Can we test? This is the English booth. Testing, testing. Could someone please confirm if...
yes, testing stuff. It's working.
She is asking in the room.
I see.
Haga una traducción al inglés.
Testing, testing. This is the English booth. She is asking for me to interpret into English. Can people hear me in English in the room? Okay, then we can continue. And with that, I give the floor to Chile.
Here today representing Chile as Undersecretary of Public Health, and I will address the committee in Spanish. Estimada
Director Barbosa, members of the front table, members of the Directing Council of the Pan American Health Organization, colleagues, friends. I would like to begin by thanking the Director for his report on the actions taken by the Pan American Health Organization this year. As we all know, the pandemic left a deep impression on our healthcare systems. In Chile, we have dealt with significant challenges. We have seen an increase in morbidity, mortality, and the interruption of essential services. Nonetheless, we have also learned important lessons that have allowed us to reorient our strategies and strengthen our commitment to public health. Also, the impact of climate change on health is something that we can no longer ignore. In Chile, we have seen that there have been extreme weather events affecting health of our population, and it is our responsibility to implement policies that will mitigate those effects. The report mentions the collaboration amongst the Pan American Health Organization and other organizations to strengthen the action of the health sector in the area of climate change, and this is an approach that we fully support. I would like to mention other priorities that we consider to be essential for the well-being of our population. First, mental health. Mental health has been one of the most affected areas by the pandemic, and it is a priority established by President Boris for our health program. We have been able to improve access to mental health services for the prevention of suicide, and we began to work with Congress on a bill, a comprehensive bill on mental health to promote and protect mental health and well-being of people, instituting mechanisms that will have a mental health approach as part of all of our policies. It's important to remember that to promote mental health, it is essential that we work together so as to destigmatize the problem of mental health, and that is a requirement for access to providing services and for social inclusion. Second, we are committed to continue our efforts in the area of primary health care, which we consider to be the backbone of a resilient healthcare system. The Pan American Health Organization has been an invaluable support in this connection, and we appreciate that. These are initiatives that promote equity and accessibility. Then, digitalization of the healthcare sector will provide better access to services, especially in remote and rural areas. That is why we are training our healthcare staff so that they can use these tools effectively. That is mentioned in the report having to do with the digital transformation of the health sector. Lastly, it is essential that our health policies deal with existing disparities. The report points to the fact that despite the difficulties, the backward slippage during the pandemic, the health sector once again has to advance towards equity and better access to health. That is why, as a country, we are devoted to implementing strategies so that all people will receive the necessary care. I reiterate Chile's commitment to regional cooperation. We feel that cooperation amongst countries is essential to deal with the public health challenges that affect us all. We are fully willing to share our experiences, and we look forward to learning from other countries in the region. Thank you. Thank you. Thank you, Chile. I give the floor to Haiti. Thank you, and I will be speaking French. Madam President, Director, Ministers, Heads of Delegation, dear delegates, it's an honor for me to represent our country in this 61st Directing Council of PAHO. I would like to first congratulate as I was saying, it's an honor to represent the Haitian people in this 61st meeting of the Directing Council. So also I congratulate the President on her election. Haiti assures its support to the purposes of this meeting. I wanted to thank the Director for presenting his report and his call to apply the lessons that we learned during the pandemic to health in the Americas. Haiti is definitely learning lessons from the pandemic, and that along the lines of the strategic priorities outlined in that report. Now, in terms of structural problems affecting women, and identification of the most vulnerable population, eliminating obstacles to the access to health services. There are some countries in the region who are in crisis, and they will receive special attention. Haiti wants to congratulate PAHO and WHO, and we thank them for the support that we have received, also on the part of the PAHO office, supporting member states that are trying to build efficient and resilient healthcare systems so as to assure health for all with equity and improve the health of the region. So Haiti takes note of the report and expresses its appreciation. Thank you very much, Haiti. I now recognize El Salvador. Thank you very much, Madam President, Director Jadabas, members of the head table, member states, colleagues, friends. It is a pleasure to receive the director's report. El Salvador has witnessed all of the strides made, everything that is possible with technical cooperation. Often we are hampered, we are limited, as the director said, but we think that teamwork is important. When we talk about a team, I mean everyone, PAHO, organizations, member states, also countries from nearby regions and regions far away. At the same time, what we see is that the results of technical cooperation have been very fruitful in our region, thanks to the progress made by President Nayib Bukele. He has given priority to national and state health for the entire population. We have made important progress in terms of our vaccination campaigns. We have rebuilt the vaccination system. Also, with digitalization, we have made important strides. We have worked bilaterally with other member states of WHO, and we have developed SysMed 911. That gives us a pre-hospital care model. That is something that is new to our country and is completely free of charge. At the same time, we now have, thanks to TC, the ability to deal not only with ENTs, but eliminating them. And that is a milestone in public health. And we hope to be able to continue to work in this way so that we will have a region, a continent, a world that will be ever better if we continue to work as a team. Thank you. Thank you very much, El Salvador. Now I recognize the United States.
Thank you, Madam Chair. The United States welcomes Dr. Barbosa's annual director's report. Country-centered cooperation, reflective of member states' unique needs, remains critical to achieve our shared goals and to improve access to evidence-based health information and services in the Americas. We commend the Secretariat's ongoing work to find solutions to global health challenges like reducing maternal mortality rates, improving prevention and care of non-communicable diseases, and expanding digital health innovations. Equity remains at the heart of health for all. As highlighted in our engagement at UN High-Level Week, the United States remains supportive of efforts to meet the prevention, diagnosis, and care needs of those affected by non-communicable diseases, as well as building resilient and responsive health systems. We thank Director Barbosa for your continued leadership and commitment to improving the health for all people in the region. Thank you.
Thank you. Thank you, United States. I recognize the Secretary for some announcements. Thank you very much, Madam President.
We would like to invite all head of delegations to stay in room A for the official photo. Also, we would like to inform delegates that after the official photo, the briefing session, Elimination Initiative implementing innovations and best practices for communicable diseases elimination in the Americas, will take place in room B during the lunch break. A light lunch will be provided for delegates joining the briefing session. Finally, the General Committee is scheduled to meet in room 712 on the 7th floor at 1 p.m. Thank you, Madam President.
Muchas gracias.
Thank you. So we will now break for lunch, and we come back at 2 p.m. Thank you.
Need to remain in room A for the official picture. Okay? Todos los jefes de delegación,
All heads of delegation, one person per delegation, will stay here in room A. And since the weather isn't very favorable, we'll be taking that picture inside.
Larguísimo este punto.
Yep, it is. Yep, I'll be there. 1, 2, 3, 4. Oh, cool.
Check 1, 2. Check 1, 2.
La Semana de Vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la Semana de Vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
The Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters of the Pan American Health Organization, located at the United Nations Humanitarian Response Depot in the Regional Logistics Center in Panama. The reserve has been established as part of in supplies when needed, providing a rapid, coordinated, and effective response. This is achieved thanks to the coordination among different teams, needs assessment, integration of logistics systems, and the connection of special emergency administrative processes. The technical and operational management of the reserve is under the responsibility of the Department of Health Emergencies of the Pan American Health Organization, in close coordination with technical areas and support entities at the regional level. The benefits of this mechanism include reducing delivery times, decreasing the risks of delays, ensuring safe storage, compliance with quality standards, and an integral vision of health service delivery. The reserve has provided support in situations such as floods, earthquakes, volcanic eruptions, tropical storms, hurricanes, disease outbreaks, and prolonged emergencies in the region. In addition, there is an identified and updated inventory through technical analysis based on lessons learned and experience from previous events. With this, the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters demonstrates that, in the face of emergency situations in our region, it is a fundamental mechanism of support for affected countries to protect the most vulnerable and save lives.
La Alianza por la Atención Primaria de Salud en las Américas, lanzada en diciembre de 2023 por la Organización Panamericana de la Salud, el Banco Interamericano de Desarrollo y el Banco Mundial, tiene como objetivo fortalecer los sistemas de salud de la región basados en la atención primaria, para que sean resilientes y equitativos, y avanzar hacia la salud universal. Bajo el liderazgo de los Ministerios de Salud y la colaboración entre la OPS, el BID y el Banco Mundial, la alianza promueve una acción coordinada que oriente y articule las inversiones en la salud, aproveche las innovaciones y acelere la transformación de los sistemas para mejorar el acceso y reducir las inequidades.
Desde el lanzamiento de la Alianza por la Atención Primaria de Salud, hemos visto un enorme interés por parte de los países de América Latina y Caribe. Estamos financiamiento en la atención primaria de salud bajo el liderazgo de los ministerios de salud y con nuestros socios de la alianza, mejorando la planificación estratégica y la asignación de recursos. Ya sea para mejorar la salud materna e infantil, prevenir y gestionar las enfermedades transmisibles o mejorar la atención y tratamiento de enfermedades no transmisibles, la alianza está apoyando a los países para que inviertan, inovem e implementem mejor, basándose en la estrategia de atención primaria de salud. Como hemos visto en el diálogo sobre financiamiento de la salud organizado para el Caribe, la alianza puede unir a los sectores de salud y finanzas en torno de una agenda común: mejorar la salud para todos.
La alianza está liderando intervenciones integradas y planes de acción en 10 países de Latinoamérica y el Caribe, y ha apoyado el diálogo entre salud y finanza en 8 países del Caribe. Los esfuerzos conjuntos también están enfocados en el desarrollo de 4 bienes públicos regionales.
Desde el Banco Mundial y trabajando en alianza con el BID y la OPS, estamos comprometidos en apoyar a los países a través de financiamiento, asistencia técnica y ampliando el conocimiento. Hemos formado, por ejemplo, la Comisión Lancet de las Américas, que nos ayudará a entender mejor cómo proveer una atención primaria más efectiva y que llegue a todos. Celebramos el compromiso político de varios países de la región en apostar por la atención primaria de salud como un vehículo transformador y fundamental para alcanzar la cobertura universal y cumplir nuestra meta para el 2030 de ofrecer servicios sanitarios asequibles y de alta calidad a más de 1.500 millones de personas en el mundo.
En el BID, nuestro compromiso con la salud de América Latina y el Caribe es constante. La atención primaria es una prioridad y la estamos llevando al siglo XXI. Una atención primaria moderna es fundamental para abordar los retos de salud de nuestra región, como las enfermedades crónicas y la salud mental. Además, es crucial para enfrentar desafíos globales como el cambio climático y futuras epidemias. Nuestra alianza con la OPS y el Banco Mundial fortalece aún más este compromiso. Juntos y bajo el liderazgo de los países, estamos creando un futuro donde cada persona en nuestra región tenga acceso a sistemas de salud digitales y resilientes.
Con un enfoque participativo y centrado en la acción en los países, se ha avanzado en alianzas estratégicas a nivel nacional, impulsadas por las autoridades, basándose en sus necesidades y prioridades de salud.
Con esta alianza haremos que la atención primaria sea más fuerte en cada rincón de la República Dominicana. Trabajaremos para que nadie se quede atrás. Además, promoveremos una mayor coherencia entre las iniciativas regionales de la APS para hacer que la atención médica sea más ágil, con menos fragmentación, mejor acceso y sobre todo más equidad. Invertir en la atención primaria es invertir en un futuro más justo y sostenible. La salud es un derecho de todos. Juntos estamos construyendo un sistema de salud más fuerte para un futuro donde todos estemos incluidos.
El enfoque absoluto de la Secretaría de Estado en la atención primaria en salud es absoluto. Hemos necesitado socios valiosísimos para poder hacer realidad ese enfoque que nos permita llegar a más personas y a mayor territorio. A pesar de las diferencias o de las dificultades que podamos tener en ese alineamiento, que hay que reconocer no es fácil, son más los puntos de encuentro que los de desencuentro. Y eso nos ha permitido como país grandes mejoras y mejores cosas que vendrán. Estamos optimistas, estamos esperanzados, estamos agradecidos, pero sobre todo comprometidos. La atención primaria es la clave para tener países saludables y productivos.
La alianza continuará trabajando para fortalecer los sistemas de salud en la región, basados en la atención primaria, para ampliar la cobertura y garantizar el acceso universal a la salud, para todas las personas, en todas partes.
La resistencia antimicrobiana
antimicrobiana es cuando no tomas tu medicina a su debido tiempo y a su debida hora, y eso hace que tengas una resistencia en tu cuerpo.
Los microorganismos para evolucionar necesitan determinados mecanismos que les permitan seguir viviendo. Los antibióticos, los antiparasitarios, que las hemos utilizado como medidas terapéuticas, hacen que ellos, para poder seguir sobreviviendo, desarrollen mecanismos de defensa y mecanismos que se llaman de resistencia.
La resistencia antimicrobiana es un proceso natural, pero que la actividad humana la ha acelerado a través del consumo excesivo de los antibióticos, tanto para tratar enfermedades como también para la alimentación en los animales.
Se vuelve un problema porque las enfermedades que antes se podían combatir más fácilmente, hoy nos encontramos con que no está pasando así, ¿no?
Es un problema médico porque muchos pacientes, uno les da un determinado tratamiento y ese tratamiento no funciona. Entonces tenemos que buscar líneas de antimicrobianos más elaboradas y a veces no funciona ninguna. Pero también tenemos que pensar que es un problema de la salud planetaria, porque los antibióticos no solamente llegan a nosotros por una prescripción médica, por una automedicación, sino que también vienen en alimentos.
Lo mismo que pasa en la agricultura, gran uso de plaguicidas, lo que vemos con los sistemas ganaderos, aún muchas veces los de pequeña escala, es que están altamente hacinados los animales en base a alimentos que no son propios y fundamentalmente con gran cantidad de antibióticos. Cada vez más antibióticos porque la resistencia recrea esto, más necesidad. Por un lado, punto de vista económico, más caro. Por otro lado, esos antibióticos terminan en el suelo, terminan en el agua y después terminan en nosotros los seres humanos.
Tiene que ver con que se ha perdido ese sentido de equilibrio. Ya no puedo protegerme. Y esa desprotección hace que sienta otra vez, entramos en ese círculo de violencia, de desprotección, de sentirme atacado, entonces tener que volverme en un depredador.
Tenemos que pensar un paradigma productivo diferente, cómo hacemos para que nuestros animales tengan salud. No pensar en la enfermedad y poner un antibiótico, sino qué hacemos para que no necesitemos antibióticos.
Por eso directamente, si queremos hablar también de la resistencia a los antimicrobianos y cómo vamos a paliar esto, cómo vamos a detener esto, pues hay que volver necesariamente al origen, que es volver a cuidar a nuestra madre tierra.
Es importante hablar de comunidades empoderadas. Siempre que nosotros mencionamos una sola salud, tenemos que comenzar de abajo hacia arriba. Porque abajo están las sabidurías, están los conocimientos.
Porque es la gente desde abajo, desde las comunidades que han sido también formadas en ese sentido, ¿verdad? Para que tengan información suficiente para saber cómo es el problema y para proponer soluciones. Y es importante que se haga desde abajo, desde los liderazgos comunitarios, porque son quienes están sufriendo los efectos de toda esta condición.
Todo eso hace una sola salud. Los médicos solos, esto no es un problema de salud, esto es un problema que involucra médicos, veterinarios, agrónomos, comunidad.
Y dentro de la comunidad hay actores sociales que son fundamentales, ¿no? Y entre ellos, en el área educativa, los docentes, los promotores de salud, promotores comunitarios, tienen un rol fundamental en lo que tiene que ver con la formación, con la transmisión de conocimientos, de maneras diversas, diferentes, creativas, artísticas.
Es un esfuerzo grande, hay que trabajar con productores, consumidores, con los tomadores de decisión, con los comunicadores y nos queda un largo camino.
Desde las comunidades tendríamos que hacer un llamado bastante fuerte a los gobiernos, ir a la posibilidad de retomar cambios profundos.
Porque se necesita que los estados tomen acción a través de sus autoridades y la gente tiene que presionar a sus gobernantes para que ese proceso se dé.
Muchas veces los tomadores de decisión piensan siempre en incrementar la producción, ¿no? Incrementar la producción parece, digamos, este monocultivo mental. Necesitamos producir más, necesitamos exportar más, necesitamos producir más alimentos, necesitamos ganar más plata.
Lo que yo le diría a los líderes de los países es que ellos son decisores y nosotros necesitamos que nos escuchen como comunidad, como profesionales, como ellos mismos también, ¿no? Porque ellos están involucrados en este problema.
Me parece que los adultos y sobre todo los líderes tenemos siempre una deuda hacia las infancias y que tiene que ver con respetar lo que está en la Declaración de los Derechos del Niño, el derecho a la participación, a la libre expresión en todas aquellas temáticas que a ellos los afectan.
Si cuidamos a la madre tierra, cuidamos el aire, los alimentos, los ríos y también a las bacterias.
Quiero mirarle a los ojos a los tomadores de decisión para que podamos comprender las problemáticas que estamos transitando.
Habría que impulsar políticas públicas a favor de la gente, políticas públicas a favor de las comunidades.
Tomemos en cuenta esta problemática, esta gran problemática del abuso en el uso justamente de los antibióticos que está generando resistencia.
Me gustaría que las autoridades hagan campañas de salud para el buen uso de los antibióticos.
Este es un llamado por el derecho humano a la salud y la vida.
Los enfoques para abordar la RAM,
basados en la participación social y la colaboración global,
son la clave para encontrar soluciones efectivas.
Unidos en la diversidad,
mantenemos nuestro compromiso en esta causa global.
En la Asamblea General de las Naciones Unidas 2024.
Hay mucho por ver aquí. Se ha trabajado mucho por generar un impulso en el incremento de la calidad de vida de las personas.
En un mundo con menos enfermedades transmisibles, más personas tienen la oportunidad de construir vidas mejores, más saludables y seguras. Pero el impulso no puede detenerse aquí.
La pandemia de COVID-19 nos ha demostrado que mientras las enfermedades transmisibles sigan propagándose, nuestra calidad de vida está en peligro. Todos estamos en riesgo hasta que estemos seguros.
Por eso, la iniciativa de eliminación de la OPS se ha propuesto eliminar más de 30 enfermedades transmisibles y afecciones relacionadas para el 2030.
Para lograrlo, debemos asegurarnos de que todos en las Américas tengan acceso a vacunas y atención médica de calidad, que incluya diagnóstico y tratamiento oportunos, instalaciones de higiene, agua y saneamiento.
Esto no es un sueño, es un derecho y una responsabilidad de todos. Todos deberíamos tener igualdad de oportunidades para disfrutar de una vida saludable y plena. Hay mucho por ver aquí. Trabajemos juntos por un futuro libre de enfermedades para todos.
La semana de vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la semana de vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
So,
AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child, it's a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today. Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru.
With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance, we have been able to strengthen health systems to make them more accessible, sustainable, and resilient.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en este internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área de telesaúde. Isso aí, para mim, é como se fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Oi, eu sou a Rafaela e eu ouvi dizer que o escritório da OPAS no Brasil está fazendo um monte de coisas legais para cuidar do meio ambiente e eu vim aqui ver de perto.
Oi, eu sou Matias. Será que a OPAS é verde mesmo? Oi, sou Liz, quero trabalhar aqui no futuro.
Oi, bem-vindos à OPAS, crianças!
Nós ainda temos containers maiores que também podem ser usados para papel, para papelão, ou seja, tudo aqui pode ser reciclado.
Tá vendo essas bicicletas aqui? Ó, isso aqui a gente fez para os colegas nossos aqui da OPAS que quiser pedalar, elas ficam aqui disponíveis para todo mundo.
Aqui na OPAS a gente não usa nada descartável, só copos e garrafas reutilizáveis. E olha só que legal, nosso mexedor é de bambu.
Nós também acabamos de instalar uns painéis para captar energia solar.
A OPAS também tem um sistema de irrigação e só usa o necessário.
Oi, Rafa, para finalizar, vou mostrar para vocês os 120 ipês amarelos que nós plantamos e que hoje estão pequenininhas, mas no futuro vão ficar grandes igual aquela lá atrás.
Nós estamos cuidando do planeta também aqui. Estamos cuidando para vocês.
Nosotros como oficina de país en Nicaragua nos encaminamos a una oficina verde tomando en consideración el consumo de papel para nuestras impresoras. Tenemos una estadística que desde el 2019 fue la última vez que se compraron resmas de papel en una cantidad de 180 resmas. En el 2024 tenemos un saldo de 136 resmas. Eso indica de que solamente se han utilizado 44 resmas en 5 años, a razón de un promedio de 8.8 resmas por año en consumo. Esto también implica, si hay una reducción del consumo de papel, hay una reducción también de tóner para nuestras impresoras. La representación en Nicaragua se unió a la modalidad de trabajo en casa, lo que permitió una reducción de consumo de papelería y tóner en esta oficina. Como organización debemos de ser parte activa de la ecologización de nuestras instalaciones, adoptando políticas ambientalmente sostenibles con prácticas modernas de ahorro de energía, reducción de residuos y reciclaje.
Vamos falar da nossa experiência.
Desde el equipo de OPS en Colombia estamos comprometidos con la sostenibilidad. La sostenibilidad para proteger el medio ambiente y sobre todo para cuidar de la salud de cada uno y cada una de nosotros, los habitantes en este hermoso planeta.
Desde el 2023, la representación en Colombia aplica dentro de la evaluación de eventos competitivos criterios de sostenibilidad.
Solicitamos a nuestros proveedores el uso de empaques biodegradables o de más de un uso, la alimentación saludable y el manejo de residuos al final de los eventos.
Promovemos desde la planificación del evento el uso de la tecnología en vez de la impresión de material. Esto con el fin de ayudar al medio ambiente y a la optimización de los recursos de la organización.
Hemos tenido muy presente la sostenibilidad, no solamente en términos de lo que ha sido toda la construcción para nuestras nuevas oficinas, sino también en cada una de nuestras actividades, pensando en cuáles son los mejores materiales, el poder reducir el uso del papel y, por supuesto, velando por esa salud de cada una y cada uno de los miembros del equipo del OPS en Colombia.
Los interruptores inteligentes nos ayudan a un ahorro más eficiente de la energía. Asimismo, contamos con UPS. Esto nos ayuda a hacer un ahorro entre el 20 y el 30% de nuestro consumo de todos los equipos que tenemos en la oficina.
El compromiso con la sostenibilidad es una tarea de todos. Es por eso que desde OPS Colombia queremos dar ese ejemplo y poder continuar en este trabajo.
Hoy visitamos esta sala de vacunas Padre Monchi, aquí en Foz de Iguazú, el equipo de evaluación externa, y hemos evaluado y analizado y conversado con los colegas y trabajadores de la salud del sistema del SUS.
La evaluación consiste de varias fases, la primera de las cuales es parte del país, en el cual utiliza un instrumento de autoevaluación, y posteriormente un equipo de expertos viaja al país, visita, conoce la realidad en territorio y de esa forma les permite identificar potenciales oportunidades de mejora, recomendaciones y también fortalezas que deben ser sostenidas a lo largo del tiempo y eventualmente compartidas con otros países de la región para fortalecer las capacidades no solo a nivel nacional, sino a nivel regional.
A avaliação externa voluntária ela vem num momento muito importante para o Brasil. É um momento que o Programa Nacional de Imunizações ele passa por mudanças e reajuste, ele está tendo uma reorganização, uma reestruturação.
Lo importante de las evaluaciones es que son un mecanismo que permite al país que las solicita poder tener una idea clara de cuál es su situación actual, no solo desde su propia autoevaluación que el país la hace, sino desde la visión de un evaluador externo, lo cual no solo les permite corregir aquellas situaciones en las cuales se pueden mejorar o confirmar que el camino es el correcto, que la situación está bien llevada adelante, de manera que es un ejercicio en el cual el país tiene todo para ganar.
We saw here a lot of aha moments. People, they have not seen like that with their own eyes. And so bringing these external perspectives and these opportunities for peer learning, it's great because they can actually see things with other eyes, bring fresh perspectives, and see what are the gaps that they have not thought through, and finally address those because that will put the programs in a much better position in the future.
O Programa de Imunizações ele tem um grande desafio que é o sistema de informação. Tem um sistema de informação nominal com informações importantes do indivíduo, como também garantir os estoques e garantir que a vacina que está prevista no calendário nacional de vacinação, ele chegue até a população, seja a população mais distante, como também reorganizar a estrutura interna do programa, fazer com que toda a equipe técnica consiga trabalhar de uma forma efetiva, que essa equipe consiga produzir adequadamente e propor estratégias de vacinação para o país de uma maneira efetiva.
I'm very impressed with how the Ministry of Health has adapted to low coverage after COVID-19. And the initiatives to improve routine immunization coverage, as well as to restore vaccine confidence in the population.
Brazil is a very large and diverse country, and they've made tremendous progress. And one of the main recommendations is really strengthening laboratory and epidemiologic surveillance in support of the disease elimination goals. I think there's a lot of information systems that are really fantastic, but improving the linkages between those, as well as some improvements related to cold chain vaccine stock management and infrastructure as well.
Que lo que un país que acepta una evaluación está mostrando es que tiene capacidad autocrítica, que acepta ayuda externa, que no se queda con la única verdad que es la de ellos y que está dispuesta a seguir creciendo consiguiendo más información. Creo que los programas de inmunización tienen que convencer a sus autoridades de la importancia de mantener el intercambio con otros países y las evaluaciones.
Todavía hay mucho trabajo. Yo creo que la recuperación se está viendo, pero jamás podemos dar por sentado que eso se va a convertir en algo automático. Creo que en esta última milla para llegar a ese 95% donde todavía tenemos que emplearnos más, concentrarnos más, y por eso es que este tipo de ejercicios de evaluación, de ver cómo está el desempeño del programa de inmunizaciones, cobran una vital importancia, porque te permite justamente, o les permite a los países saber dónde está esa parte que le está apretando el zapato y cómo justamente salir adelante. Entonces, por eso es que son tan importantes ese tipo de ejercicios.
Brasil ha identificado muchas oportunidades de mejora que ya está implementando a través de este proceso. Brasil está demostrando que sí puede, que su política de salud en el Sistema Único de Salud con el programa de inmunización es una realidad para todos los brasileños y las personas que llegan a Brasil, sus fronteras y sus 5.570 municipios comprometidos con la salud de los brasileños y las brasileñas.
Los espacios subregionales son una oportunidad única para la cooperación entre países como una modalidad para la reducción de desigualdades y mejorar las condiciones de salud de sus poblaciones. Así, de esta manera, desde hace varios años, la organización puso en práctica la Iniciativa de Cooperación Sur-Sur para el Desarrollo en Salud, mejor conocido como CCHD. Y por medio de esta iniciativa, en el año 2023 se pusieron fondos semillas para financiar el proyecto de Cooperación Sur-Sur para la detección temprana del cáncer infantil en los países andinos. Esto en una estrecha colaboración con el convenio Hipólito Unanue, el Horas Cono.
Dentro de los logros más importantes, tenemos la elaboración conjunta y aprobación por los ministros de salud andinos de la hoja de ruta para mejorar la atención del cáncer en niños, niñas y adolescentes en la subregión andina en 2030.
Este proyecto de cooperación sur-sur, que incluyó el intercambio de conocimientos y experiencias entre los países de toda la región andina, ha contribuido a la creación de una política subregional, de diferentes estrategias y planes nacionales que abordan de una manera muy objetiva, muy clara y muy directa lo que es la detección y el diagnóstico temprano de cáncer infantil en todos estos países de la subregión.
Lo más importante es que existe una agenda común interinstitucional que permite sumar conocimientos y experiencias en pro de la niñez y la adolescencia, generando un impacto positivo significativo en la atención del cáncer infantil.
El video que vemos ahora nos presenta de una manera muy clara, con testimonios muy sentidos, con una muestra muy definitiva del beneficio que tiene la cooperación sur-sur para el desarrollo en salud.
Los niños son de interés superior. Los niños, desde la Convención Marco de Naciones Unidas de Derechos Humanos de Infancia y Adolescencia, son de interés prioritario y su salud también. Y por eso salvar una vida de un niño es fundamental para los gobiernos y para todos los actores.
En estos momentos en La Guajira, pues tenemos varias dificultades en el acceso a la salud en las comunidades indígenas, ya que muchas de estas comunidades son comunidades dispersas, que no se encuentran muy cerca al área urbana. Entonces, esa es la primera dificultad, el acceso y las barreras que se presentan para estas comunidades para obtener un servicio de salud. Y todos los determinantes que puedan disminuir la incidencia de esas enfermedades que están afectando a la población, principalmente indígena, como es el cáncer infantil.
Cuando yo llegué a la clínica me hicieron exámenes, me hicieron radiografía, todo eso, y después me salió que yo tenía una masa. Y después ya descubrieron que es lo que yo tenía. Tenía leucemia y floblástica aguda. Es de esa maligna.
En ese momento cuando me dieron la noticia, eso fue duro, porque no me imaginé de que ella iba a tener eso, porque ella era una peladita sana, no tenía nada.
La OPS, desde la iniciativa de mejor atención para las enfermedades no transmisibles como el cáncer, busca fortalecer las competencias, el conocimiento de los equipos de atención primaria, y es en el marco de este enfoque de equidad, de lograr justamente afectación de los determinantes sociales, que se logra este proyecto de cooperación para fortalecer las competencias, el conocimiento de estas enfermedades del cáncer infantil en niños y adolescentes, tanto en profesionales de la salud, médicos, enfermeras y otros profesionales, asimismo también en gestores comunitarios y en toda la red de apoyo social y administrativo que se requiere para lograr un tratamiento de oportunidad, detección oportuna y también de calidad.
Para La Guajira tenemos una población bastante dispersa, una población con unos determinantes sociales muy críticos
en donde definitivamente tenemos que entrar a capacitar al personal que está cerca de esas comunidades, a los mismos líderes comunitarios, para que aprendan a identificar de manera temprana el cáncer infantil y así poder hacer un tratamiento rápido. Tenemos que fortalecer las redes de atención específicas para el manejo de esos pacientes.
Todavía hay pacientes que mueren por causas que pueden ser evitables. Por eso estamos acá, porque hacer los cursos de detección temprana le damos herramientas a los médicos para que ellos puedan detectarlo tempranamente, hacer un tratamiento oportuno y evitar así la muerte temprana en nuestros pacientes.
Hace poquito me dijeron que la masita que ella tiene se está reduciendo al 75%. Ha reducido mucho.
Dejo que los cuiden mucho porque está dando mucho la leucemia y el cáncer. Y obsérvalos, no deje de observarlo.
Y aunque sea un niño, yo soy un vencedor. Yo vivo feliz porque tengo a Dios. Y aunque sea un niño, yo soy
A ella le preguntan qué se quiere ser y ella dice, no, yo quiero ser doctora.
La semana de vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la semana de vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
we introduced the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters of the Pan American Health Organization, located at the United Nations Humanitarian Response Depot in the Regional Logistics Center in Panama. The reserve has been established as part of a regional operational mechanism that supports countries in emergency situations by sending supplies when needed, providing a rapid, coordinated, and effective response. This is achieved thanks to the coordination among different teams, needs assessment, integration of logistics systems, and the connection of special emergency administrative processes. The technical and operational management of the reserve is under the responsibility of the Department of Health Emergencies of the Pan American Health Organization, in close coordination with technical areas and support entities at the regional level. The benefits of this mechanism include reducing delivery times, decreasing the risks of delays, ensuring safe storage, compliance with quality standards, and an integral vision of health service delivery. The reserve has provided support in situations such as floods, earthquakes, volcanic eruptions, tropical storms, hurricanes, disease outbreaks, and prolonged emergencies in the region. In addition, there is an identified and updated inventory through technical analysis based on lessons learned and experience from previous events. With this, the Jerónimo Venegas Strategic Reserve for Health Emergencies and Disasters demonstrates that, in the face of emergency situations in our region, it is a fundamental mechanism of support for affected countries to protect the most vulnerable and save lives.
La Alianza por la Atención Primaria de Salud en las Américas, lanzada en diciembre de 2023 por la Organización Panamericana de la Salud, el Banco Interamericano de Desarrollo y el Banco Mundial, tiene como objetivo fortalecer los sistemas de salud de la región basados en la atención primaria, para que sean resilientes y equitativos, y avanzar hacia la salud universal. Bajo el liderazgo de los Ministerios de Salud y la colaboración entre la OPS, el BID y el Banco Mundial, la alianza promueve una acción coordinada que oriente y articule las inversiones en la salud, aproveche las innovaciones y acelere la transformación de los sistemas para mejorar el acceso y reducir las inequidades.
Desde el lanzamiento de la Alianza por la Atención Primaria de Salud, hemos visto un enorme interés por parte de los países de América Latina y Caribe. Estamos trabajando con 10 países para aumentar el compromiso y financiamiento en la atención primaria de salud, bajo el liderazgo de los Ministerios de Salud y con nuestros socios de la Alianza, mejorando la planificación estratégica y la asignación de recursos. Ya sea para mejorar la salud materna e infantil, prevenir y gestionar las enfermedades transmisibles, ou mejorar a atenção e tratamento de enfermidades não transmissíveis, a Aliança está apoiando a los países para que inviertam, inovem e implementem melhor, basando-se na estratégia de atenção primária de saúde. Como hemos visto no diálogo sobre financiamento da saúde organizado para el Caribe, a Aliança pode unir a los setores de saúde e finanças em torno de uma agenda comum, melhorar a saúde para todos.
La alianza está liderando intervenciones integradas y planes de acción en 10 países de Latinoamérica y el Caribe, y ha apoyado el diálogo entre salud y finanza en 8 países del Caribe. Los esfuerzos conjuntos también están enfocados en el desarrollo de 4 bienes públicos regionales.
Desde el Banco Mundial y trabajando en alianza con el BID y la OPS, estamos comprometidos en apoyar a los países a través de financiamiento, asistencia técnica y ampliando el conocimiento. Hemos formado, por ejemplo, la Comisión Lancet de las Américas, que nos ayudará a entender mejor cómo proveer una atención primaria más efectiva y que llegue a todos. Celebramos el compromiso político de varios países de la región en apostar por la atención primaria de salud como un vehículo transformador y fundamental para alcanzar la cobertura universal y cumplir nuestra meta para el 2030 de ofrecer servicios sanitarios asequibles y de alta calidad a más de 1.500 millones de personas en el mundo.
En el BID, nuestro compromiso con la salud de América Latina y el Caribe es constante. La atención primaria es una prioridad y la estamos llevando al siglo XXI. Una atención primaria moderna es fundamental para abordar los retos de salud de nuestra región, como las enfermedades crónicas y la salud mental. Además, es crucial para enfrentar desafíos globales como el cambio climático y futuras epidemias. Nuestra alianza con la OPS y el Banco Mundial fortalece aún más este compromiso. Juntos y bajo el liderazgo de los países, estamos creando un futuro donde cada persona en nuestra región tenga acceso a sistemas de salud digitales y resilientes.
Con un enfoque participativo y centrado en la acción en los países, se ha avanzado en alianzas estratégicas a nivel nacional, impulsadas por las autoridades, basándose en sus necesidades y prioridades de salud.
Con esta alianza haremos que la atención primaria sea más fuerte en cada rincón de la República Dominicana. Trabajaremos para que nadie se quede atrás. Además, promoveremos una mayor coherencia entre las iniciativas regionales de la APS para hacer que la atención médica sea más ágil, con menos fragmentación, mejor acceso y sobre todo más equidad. Invertir en la atención primaria es invertir en un futuro más justo y sostenible. La salud es un derecho de todos. Juntos estamos construyendo un sistema de salud más fuerte para un futuro donde todos estemos incluidos.
El enfoque absoluto de la Secretaría de Estado en la atención primaria en salud es absoluto. Hemos necesitado socios valiosísimos para poder hacer realidad ese enfoque que nos permita llegar a más personas y a mayor territorio. A pesar de las diferencias o de las dificultades que podamos tener en ese alineamiento, que hay que reconocer no es fácil, son más los puntos de encuentro que los de desencuentro. Y eso nos ha permitido como país grandes mejoras y mejores cosas que vendrán. Estamos optimistas, estamos esperanzados, estamos agradecidos, pero sobre todo comprometidos. La atención primaria es la clave para tener países saludables y productivos.
La alianza continuará trabajando para fortalecer los sistemas de salud en la región, basados en la atención primaria, para ampliar la cobertura y garantizar el acceso universal a la salud, para todas las personas, en todas partes.
La resistencia antimicrobiana es cuando no tomas tu medicina a su debido tiempo y a su debida hora, y eso hace que tengas una resistencia en tu cuerpo.
Los microorganismos para evolucionar necesitan determinados mecanismos que les permitan seguir viviendo. Los antibióticos, los antiparasitarios, que las hemos utilizado como medidas terapéuticas, hacen que ellos, para poder seguir sobreviviendo, desarrollen mecanismos de defensa y mecanismos que se llaman de resistencia.
La resistencia antimicrobiana es un proceso natural, pero que la actividad humana la ha acelerado a través del consumo excesivo de los antibióticos, tanto para tratar enfermedades como también para la alimentación en los animales.
Se vuelve un problema porque las enfermedades que antes se podían combatir más fácilmente, hoy nos encontramos con que no está pasando así, ¿no?
Es un problema médico porque muchos pacientes, uno les da un determinado tratamiento y ese tratamiento no funciona. Entonces tenemos que buscar líneas de antimicrobianos más elaboradas y a veces no funciona ninguna. Pero también tenemos que pensar que es un problema de la salud planetaria, porque los antibióticos no solamente llegan a nosotros por una prescripción médica, por una automedicación, sino que también vienen en alimentos.
Lo mismo que pasa en la agricultura, gran uso de plaguicidas, lo que vemos con los sistemas ganaderos, aún muchas veces los de pequeña escala, es que están altamente hacinados los animales, en base a alimentos que no son propios y fundamentalmente con gran cantidad de antibióticos. Cada vez más antibióticos porque la resistencia recrea esto, más necesidad. Por un lado, punto de vista económico, más caro. Por otro lado, esos antibióticos terminan en el suelo, terminan en el agua y después terminan en nosotros los seres humanos.
Tiene que ver con que se ha perdido ese sentido de equilibrio. Ya no puedo protegerme. Y esa desprotección hace que sienta otra vez, entramos a ese círculo de violencia, de desprotección, de sentirme atacado, entonces tener que volverme en un depredador.
Tenemos que pensar un paradigma productivo diferente, cómo hacemos para que nuestros animales tengan salud. No pensar en la enfermedad y poner un antibiótico, sino qué hacemos para que no necesitemos antibióticos.
Por eso directamente, si queremos hablar también de la resistencia a los antimicrobianos y cómo vamos a paliar esto, cómo vamos a detener esto, pues hay que volver necesariamente al origen, que es volver a cuidar a nuestra madre tierra.
Es importante hablar de comunidades empoderadas. Siempre que nosotros mencionamos una sola salud, tenemos que comenzar de abajo hacia arriba. Porque abajo están las sabidurías, están los conocimientos.
Yes, no, like, that's good.
Buenas tardes.
Good afternoon. If there are any delegates outside the room, could you please come in, take your seat so that we can count how many people we have and see if we have a quorum. And by the way, let us make sure that we have interpretation working right. I will be speaking Spanish. If you have your headsets ready, please switch to the language of your choice, and I'd be very grateful just to make sure that interpretation is working, that the technical side of interpretation is working.
So we have quorum now. We are ready to start the afternoon session. Thank you. We are going, okay.
Muy buenas tardes. Vamos a continuar.
Good afternoon. We will continue with 3.2, and I would call on Guyana, please.
Thank you very much, Madam President. Colleagues, Guyana would like to thank Dr. Barbosa for a very comprehensive report in documenting the region's successes. And of course, while we had some challenges, pointing the strategic direction in where we should be going. We would like to join in congratulating Dr. Barbosa for his leadership, and we are very grateful for the partnership that we've had with PAHO. Over the last year, we have received comprehensive technical assistance from PAHO in areas such as disease elimination, and we are very pleased to be part of this initiative. Guyana has focused on 5 of the neglected infections, and we think with the assistance of PAHO that we'll make significant progress. In addition to these 5, we've also looked at cervical cancer, and we have developed a very comprehensive program. And with the assistance of PAHO and the medication through the strategic fund, we have also been able to implement a hepatitis C program in Guyana. We also are very thankful for the support we have received in non-communicable diseases, especially in the rollout of the HEARTS program. And one of the most innovative programs that we have been able to work with both PAHO and Brazil is the implementation of training of nurses in Guyana using a hybrid method. This has helped us to alleviate the challenges that we have with nurses migration by being able to upscale the training and being able to train more nurses than we would have usually been able to do using traditional methods. We are also very thankful for the assistance we have received in terms of working on developing new legislation. And with the assistance of PAHO, we have now drafted new public health legislation that hopefully by the end of this year, we'll be able to pass in our parliament. Digital health is another component that we have been working on, and we are very grateful that PAHO has been working in this space as well, and we look forward to leveraging the tools that PAHO has in terms of expanding our telehealth program in Guyana. So in all of these areas, we are very thankful, and we look forward to continued collaboration with PAHO as we strengthen this partnership between PAHO and Guyana. I thank you.
Muchas gracias, Guyanas. Ahora cedo la palabra a Bahamas.
I now call on the Bahamas.
Thank you. Thank you, Madam President. Is that? Sorry? I'm on? Thank you, Madam President and distinguished delegates. The Bahamas extend its appreciation to Dr. Barbosa for his comprehensive report. While the COVID-19 pandemic strategically disrupted healthcare delivery systems in my country by exposing long-standing systemic barriers, PAHO has steadfastly maintained its leadership role in the Americas. The Bahamas is pleased to be among the 10 countries in the region of the Americas which have begun the journey towards crafting evidence-based roadmaps to enhance our essential public health functions. We are also improving access to quality medicines and technologies by expanding access to safe, high-quality vaccines, medicines, and technologies by way of PAHO Strategic Fund. We once again extend our gratitude to PAHO for its unwavering commitment to health system strengthening during these challenging times. Madam President, the public health approach to addressing gang violence is at the center of the Bahamas' fight against escalating surge of morbidity and mortality brought on by violent crimes among young males in our society. While the reality of crime, climate change, and climate refugees are major challenges for the Bahamas, our quick mitigation efforts are evidenced by the completion of our National Health Adaptation Plan, and we are marking significant progress in addressing environmental health threats across our archipelago. Non-communicable diseases continue to pose a momentous threat to our local healthcare system and is now affecting the well-being of our population, particularly the elderly. Better integration of mental health services at the primary healthcare level by way of our new Mental Health Act is bringing forth promising results in treatment. Our Prime Minister remains committed to providing adequate financial and human resources for health despite our priorities not being fully addressed. We are fully committed to the relaunch of disease elimination initiatives with a focus on addressing the root cause of communicable diseases with PAHO's sustained support in accessing high-quality vaccines and medicines. Our progress in digital transformation with the improvements and information systems for health and the strengthening of data system is posing for the achievement of real health system transformation. Finally, Madam President, Dr. Barbosa's report underscores substantial achievements in regional health needs and highlights many vulnerabilities, determining the requirements for PAHO's continued support to member states as we move together as a region to meet our desired healthcare needs. I thank you.
Thank you very much, Bahamas. And I now call on Ecuador. Thank you very much. Ecuador would like to thank the Director of Pan American Health Organization and highlight the achievements accomplished in the second year administration, which have been clearly detailed in the report, particularly those that refer to the sustainable recovery of member states after the pandemic. Within the initiatives presented in the report, I'd like to mention that Ecuador, after the COVID-19 pandemic, has made an effort to address multiple problems made more accurate by the pandemic. respiratory viruses, COVID at the national level, and we have kept vaccination up throughout the country. Since 2024, COVID became part of the regular vaccination schedule as per the World Health Organization. Likewise, the Ministry of Public Health is developing a significant action for the elimination of communicable diseases, such as establishing clinical practices for the prevention and diagnosis of HIV/AIDS in Ecuador, elimination of malaria, and the protocol for clinical detection of Hans disease. We have kept programs to strengthen prevention and treatment of non-communicable diseases. For instance, we've been implementing the HEARTS initiative, the drafting of a practical guideline on diabetes mellitus, as well as a national cancer council. Ecuador believes it's very important to highlight actions to avoid maternal deaths. We therefore have a project to prevent teenage pregnancy in Ecuador, with which we have educated teenagers about sexual and reproductive health, and we have done this at several health centers. We've also undertaken the launching of a manual on good practices for the prevention of obstetric violence with the training of healthcare professionals at the national level. We've also coordinated to improve the functions of the hand health system and technological tools that allow us to move towards digital transformation. Ecuador is implementing the PERC-COST tool in 25 hospitals with the purpose of improving the performance of each one of the establishments and take better decisions on and benefits with the information collected. With the support of the President of the country, we have changing the policy of digital transformation in the health sector, as well as the Digital Health Agenda 2023-2027. And finally, Ecuador takes note of the report and urges the Secretary to continue strengthening international cooperation in each one of the strategic lines that are laid out in the present report. Thank you very much.
Gracias. Muchas gracias, Ecuador. Ahora le damos.
Thank you, Ecuador. I now call on Colombia. Thank you, Mr. Chair. Madam Chair, we thank you, the report of the Director of the Pan American Health Organization, and extend greetings on behalf of the President of Colombia, Gustavo Petro, and the Minister of Health, Mr. Jaramillo. I would like to join those who have expressed solidarity with the disasters of climate occurrences in Central America and the United States. And we reiterate the urgent need that, given deep effects of climate change throughout the American continent, we need to strengthen the necessary activities to adapt and undertake climate justice. As our president said at the United Nations General Assembly, we should exchange debt for climate action. Colombia has moved forward with the strategy of the Pan American Health Organization led by Director Jarvis. That's why in the area of governance and transformation, we insist on a structural reform of the health system to ensure guarantee of fundamental rights, where we move from just ensuring a market to social insurance on a universal basis based on a preventive primary health care system. While the reform takes place, Colombia has undertaken an ambitious program with 10,000 medical teams throughout the country. We have developed in the last 2 years the broadest recovery, expansion, and modernization strategy through close to 1,500 infrastructure and transportation projects in the last 30 years to consolidate the comprehensive networks for health services, to eliminate access barriers, and achieve health equity. We have undertaken a dialogue from government with the ethnic groups to establish intercultural health system to eliminate discrimination and structural racism. In the area of elimination and control of racism, with the support of the Pan American Health Organization, we have relaunched our comprehensive program for 26 events: trachoma, malaria, uterine cancer associated with BPH. We have stopped We have improved vaccination. We will include new biologics, and we have begun vaccinating children, not just girls, against boys, not just girls against VPH. We've also developed programs against maternal mortality with consistent attendance of 30%, and a plan against the most frequent cancers by early detection and improving the opportunity for diagnosis and treatment. We've also successfully advanced the elimination of tobacco consumption. We have set up also programs against sugared beverages and proper labeling for food. We've also a shock plan for the prevention of mental health and mental suffering, particularly to prevent suicide. We've included this as a risk and damage reduction to avoid psychoactive substance use. We've also improved sanitary conditions through public and private and mixed programs to produce vaccines, to produce medication for forgotten diseases, to strengthen regulation through the relaunching of an initiative for a regional regulatory agency with the support of PAHO. We've issued the first mandatory license in the region, the third in the country, for a first-line medication for patients with HIV/AIDS, and we have improving our epidemiology by organizing a first genomic center at the National Health Center. We'd like to thank PAHO for their support in raising the level of debate and the reform of the health in Colombia based on primary health care, and the joint effort that allowed us to undertake a major event to eliminate uterine cancer in Cartagena that took place last June. And together with PAHO, the World Health Organization will organize the ministerial summit to eliminate violence against boys and girls the 6th, 7th, and 8th of November in Bogota. The School for Care to Migrants, together with ACNUR and WHO, and the elimination of air pollution in February of 2025, and the World Conference on drug use in 2025. We would rate our invitation to COP16 in Cali on the 20th of October, the Global Summit for Biodiversity, which will bring together the entire planet on behalf of life and health. And finally, the government of Colombia is sparing no effort to achieve total peace, including peace with nature, the comprehensive battle against drugs under the paradigm of human rights and public health, and to consolidate a universal public health system for health and peace. We'd like to thank Dr. Jarvas, and we hope that PAHO helps us achieve these goals. Thank you.
Muchas gracias, Colombia.
Thank you, Colombia. I'd like to remind the colleagues to please speak a bit slower so as to facilitate interpretation. I'd also like to remind you that each country has 3 minutes allowed for their presentations. I now call on Cuba.
Señora Presidenta.
Madam Chair, Dr. Jarvis Barbosa da Silva, Director of the Pan American Health Organization, distinguished ministers of health, excellencies, Cuba fully supports the report given by the director on the topics presented and acknowledges the effort done by PAHO to achieve better health outcomes, to make human rights, the human right of health, reality, and it's one of our main challenges and our commitments to fulfill the objectives of sustainable development of the 2030 Agenda. In a much more globalized world and interconnected world, we could not have health for all unless we work together. In the last few years, it's become obvious that it's very important to manage health systems from a comprehensive perspective so that we can address the social determinants and environmental determinants that impact the health of a population. Also, like with the global area in our region, we should focus on preventing the resurgence of new health emergencies and also in strengthening our response capacity so that we can ensure that all countries have the financial mechanism and adequate scientific collaboration. Cuba has actively participated in the negotiations for a legal instrument to prevent and respond to a pandemic with the political will to achieve a consensus agreement. Madam Chair, we would like to thank the fact that you've included in the agenda of this Directing Council several topics where Cuba will participate and describe our modest experience. In Cuba, intersectoral integration on behalf of public health is a reality, thanks to the constitutional responsibility the state has to guarantee universal access, free of charge, and good quality public health services for the people of Cuba. Primary health care is the basis and the main strength of our system. It is in our communities where this intersectoral work can be seen and is very visible. There, the specific problems of each health area become a priority of the government at all levels. Public will, as well as a community system, health system, and the analysis of the community health system by giving priority to risky population groups and by the introduction of the results achieved through our biotechnology industry for the benefit of our patients has led to significant accomplishments represented in the Cuban health system today. Madam Chair, to work together for health care for all, we must eliminate the coercive or unilateral measures that prevent enjoyment of health, such as the economic, commercial, and financial blockade imposed against Cuba, which we strongly reject. Likewise, the arbitrary designation of my country as a country that sponsors terrorism by preventing us from strengthening our health systems in all aspects, by limiting access to treatment, equipment, and products. Madam Chair, Cuba will continue to with its commitment to the people that need us. We're very proud of the fact that we were able to contribute to improving the health and the quality of life of the populations in all latitudes of the world through 61 years of medical cooperation with 600,000 cooperants. Currently, we are providing cooperation in 56 countries with more than 23,000 collaborators. We provide medical collaboration. 17,813 people assist other populations in the region of the Americas. I'd like to take this opportunity to extend an operation to the 5th International Convention, Cuba Health 2025, and the associated fairs that will take place under the motto Universal Health and Health Equity based on the health paradigm Focus on Health in April of next year at the Convention Center in Havana, Cuba. This will take place, and you are all invited. Madam Chairman, I would like to reaffirm that we're part of a single world where the establishment of partnerships, cooperation, and solidarity amongst individuals, governments, and organizations will lead to a healthier and sustainable world by protecting and preserving the health of everyone. Thank you.
Muchas gracias, Cuba.
Thank you, Cuba. I now call on Honduras. Good afternoon. I would like to extend a very warm greeting on behalf of our President Maracastro Sarmiento, and same greetings to all the distinguished heads of the delegation and ministers who are present here today. Honduras would like to extend a deep appreciation and congratulations to the director of the Pan American Health Organization for his report. We appreciate the support we've received as a priority country in helping us deal with public health challenges. We are committed to the strategy of providing primary health care and to strengthening the essential public health functions, which is the first pillar in primary health care. We have therefore developed a national plan for restructuring health in 2024-2030. This plan aligns itself with the goals of sustainable development. The strategy of comprehensive healthcare networks that base themselves on primary health care and family health teams have strengthened our first and primary health care level. Our commitment is also to the health of women through her course of life, from preconception to postmenopausal period. Our goal is to have zero maternal and neonatal deaths by ensuring quality care for women and newborns. In the area of vaccination, we have worked to expand coverage and achieve and maintain the historical achievement at the level of immunization, which is a national health priority. The expansion of access to health services is of great importance to us. We are building 8 new hospitals, and we have given priority to the logistic management of medication and products to address the most vulnerable populations, including women, children, and people who are in a mobile situation, and HPV communities through cultural relevance projects. Honduras, as a country subject to many threats, including climate and public health threats, intends to undertake an external voluntary evaluation under the international health regulations in order to strengthen our response capacity to future risks. We have made progress in eliminating diseases such as malaria, leprosy, and others, and in the implementation of a roadmap to bring about digital transformation in the health care by providing access and equity to health services. We would like to thank the Pan American Health Organization for encouraging cooperation and making our efforts more visible. Honduras is moving forward with great determination, and we urge member states that the health of every individual in the Americas should become our shared priority. It's only through solidarity and a spirit of Pan-Americanism that we can build a future where every citizen has access to quality care, improving the health of the most vulnerable, and strengthen the texture of our nations. Let this be an inflection point in our cooperation. We must keep in mind that the real strength of our region is our collective commitment, and we therefore request that Honduras be considered as a site for regional meetings, always from the perspective of providing differentiated support to Honduras as it is considered a priority country. Thank you. Thank you, Honduras. I now call on Belize.
Distinguished delegates, it is an honor to address the 61st Directing Council of the Pan American Health Organization. Today, we gather to celebrate the achievements and progress made in public health across our region, as highlighted in the annual report of the Director of PAHO, themed Post-Pandemic Momentum, Implementing Lessons Learned and Recovering Public Health in the Region of the Americas. One of the notable accomplishments this year is the remarkable progress made by Belize in public health. Belize has successfully eliminated malaria, a milestone that underscores the nation's commitment to health and well-being. This achievement is the result of years of dedicated efforts, strategic planning, and collaboration between government agencies, healthcare professionals, and communities. The elimination of malaria not only improves public health, but also enhances the quality of life and economic prospects for the people of Belize. Additionally, Belize has been certified for eliminating the transmission of HIV and syphilis from mother to child. This outstanding achievement is a testament to the effectiveness of integrated healthcare services and comprehensive prenatal care. It highlights the dedication of healthcare workers who ensure every child has the opportunity to be born free of these infections. This success is a critical step towards achieving broader public health goals and reflects Belize's commitment to ensuring the health of future generations. We would like to extend our heartfelt thanks to Dr. Jarbas Barbosa for the unwavering support PAHO continues to offer to Belize and the region in addressing these and other health challenges. Your leadership and dedication have been instrumental in guiding our efforts and achieving these significant milestones. As we focus on post-pandemic momentum, it's clear that the lessons learned during the pandemic are vital in shaping our recovery and strengthening our health systems. Belize's achievements exemplify how implementing these lessons can lead to substantial health improvements and resilience. In conclusion, as we reflect on the progress detailed in the Director's annual report, let us reaffirm our commitment to advancing health and well-being for all the people in the Americas. Together, let us continue to make strides in eliminating diseases, improving healthcare access, and ensuring healthier future for all our people. Thank you.
Muchas gracias.
Thank you very much, distinguished delegate from Belize. And now I call on Costa Rica. Distinguished Director Jarbas Barbosa da Silva, distinguished participants to the current session of the Directing Council, officials, delegates, good afternoon, everyone. On behalf of the government of Costa Rica, it is a great pleasure for me to express our gratitude to Dr. Barbosa for the annual report presented, which is a work done, and particularly it reflects the work done by a team committed to providing the best practices for the well-being of our region. Thank you very much. This document not only gives us a detailed vision of the challenges faced by a region in the matters of public health, but also how to overcome these. Therein lies the difference and also the major challenge that it brings to all of us. From Costa Rica, we greatly value the initiatives provided by PAHO in leading us in order to strengthen primary health care, an area where historically we are already highly committed. I would like to extend my special gratitude for the work for the team that worked in Costa Rica, because in a short term they provided important transformations that the government of the Republic had as a vision, and now they've become a reality or will soon become one. And I'll give you a few examples because I believe that we all talked about strategic lines of work that all countries have in common, but there are things that each one of us does differently. We move forward differently, and it would be good to share them, particularly now where we're gathered here today. For example, now, this last May, we launched the National Health Policy with a 2023-33 policy where one of the axes is innovation to digital health and health technologies. Health technologies that we're already working together with you because we truly wish to be leaders in this line of work. Secondly, the support in order to have new protocols to approach a patient with a dengue at the different levels of care. Since 2013, we had no death, and last week, regrettably, we had to report the first 5 deaths caused by this. And therefore, not only have you cooperated regarding updating the approach and how to address it, but in retrain our entire staff in order to better deal with these patients. The donation of a self-test, HIV test, for the beginning of a pilot project that will soon be launched. The support in toxicology with 2 toxicologists to assess the risks imposed by products to degrade pesticides in potable water, and we will continue with better supervision and monitoring to ensure water quality. Digital health. A few months ago, we launched the paths IHR7 in order to operate. And let me tell you, last week, we already started to have the recent data of these guides on epidemiological surveillance. We are already feeding this in real time with dengue that will greatly assist us in decision making. We have many other lines, but in conclusion, I reiterate our gratitude for all the support and technical cooperation provided to Costa Rica, and Costa Rica reaffirms its commitment to continue working together with PAHO and the rest of the member states. Thank you very much, Costa Rica. And now we give the floor to St. Vincent and the Grenadines.
Thank you very much, Madam Chair. Dr. Barbosa, distinguished ministers and delegates, St. Vincent and the Grenadines thanks the Director and PAHO for its stalwart leadership over the last year. The work you have advanced over the last 12 months speaks volumes of your commitment and leadership in health to the region. We are proud to be associated with several initiatives outlined in the Director's annual report. St. Vincent and the Grenadines has successfully eliminated the mother-to-child transmission of HIV and syphilis. This is a major achievement and a huge step forward for public health in St. Vincent and the Grenadines. And I thank the Pan American Health Organization for their unwavering support and guidance throughout this process. The HEARTS initiative has been adopted and implementation is ongoing in St. Vincent and the Grenadines. We recognize and appreciate the support from the Office of the Eastern Caribbean Countries and the work of Dr. Taroline Malcolm in this regard. The climate crisis and health are indeed very concerning to us. The devastation left by Hurricane Beryl on July 1st, 2024 will never be forgotten. The recent events have not only caused significant damage to the public health infrastructure, but have also disrupted care delivery and posed a threat to the progress made in public health. We thank PAHO for its significant support in our recovery efforts. Access to health technologies and equitable health care is of paramount importance to our region. St. Vincent and the Grenadines duly acknowledges and supports the Bureau's commendable efforts in this regard. Implementing countermeasures to pandemics and other public health threats is crucial and can be transformative in our collective efforts. Through sustained collaboration, we can work towards reducing the access inequities and building resilience for our region, particularly for small island developing states. The elimination of cervical cancer is a significant focus for St. Vincent and the Grenadines and falls well within our purview. St. Vincent and the Grenadines takes note of the provisions regarding revolving funds and are prepared to fully capitalize on the opportunities they present. Thank you, Madam Chair.
Muchas gracias.
Thank you very much, St. Vincent and the Grenadines. And now we give the floor to Bolivia. Thank you very much, Madam Chair. Representing the plurinational state of Bolivia, with our President Luis Arce Catacora and the Minister for Health and Sports, Maria Rene Castro, Bolivia, as outgoing member of the Directing Council, would like to express its gratitude addressed to the Director of PAHO, Dr. Barbosa, and we greet the members of the Council and to each and every one of the countries participating in the 61st Directing Council. We congratulate the Director of PAHO for this report, and in that line of joint work, exposing the expansion of universal health with equity, the implementation of state policies and much more solidarity with principles of innovation and equity, same principles that the plurinational state of Bolivia have been enforcing, executing in different ways towards the expansion of an approach of One Health and the establishment of a public health institute. The creation of a new system with information in health with principles of interoperability in such a way that we can universalize the use of information for the benefit of the population and facilitating and planning of the different interventions in health. The expansion of technology such as the implementation of telehealth, technology linked to access to health, having specialized human resources operating in the most remote areas in the countries, the progress made with a single registry of a newborn, which enables us and provides us with the possibility of analyzing a highly problematic issue such as denominators in our country in order to identify these access gaps, which exposes an efficient strategic planning for the different levels of care. The single record of vaccination electronically done reduces these vaccination gaps by identifying children with 0 doses. It has progress supported by a single health system looking for the universalization of health services with equity, taking care of the most vulnerable populations in health. Concentrating this care in the population with a vision of eliminating the diseases identified at a global level, stepping up vaccination with the access of EPH for males in this undertaking is very important in order to look for the control of cases of cervical cancer in our children or in our people and low communities area.
Los cambios climáticos.
We have to take into account climate change, which is impacted by fires, which forces us to align resilient care policies from an intersectoral, interministerial point of view in these issues that are very important to be taken into account in our country. We're very grateful for the report, and we're ready to continue cooperating and awaiting the cooperation of all members in the Latin and Caribbean countries. Thank you.
Gracias, Bolivia.
Thank you very much, Bolivia. We now give the floor to Barbados.
Thank you very much, Madam Chair, Director of PAHO, distinguished delegates. Barbados thanks the Director, Dr. Barbosa, for his comprehensive annual report and expresses full confidence in the organization's ability to continue to navigate member states through the post-pandemic recovery phase. Barbados supports the 5 flagship initiatives recognized by Dr. Barbosa, which include disease elimination, 0 maternal deaths, better care for non-communicable diseases, digital transformation of the health sector, and the reinforcement of regional production of vaccines and health technologies. Barbados realizes that in the post-COVID period, the gains made towards achieving the SDGs may have fallen short, particularly in the areas of immunization against vaccine-preventable diseases, new and emerging infectious diseases, climate change and health, antimicrobial resistance, and non-communicable disease. We therefore support a new strategic direction that promotes empowerment of our citizens and communities to achieve better health outcomes. We are pleased to have received technical expertise and guidance for the development of a climate change health national adaptation plan and the support being received from PAHO and the Caribbean Public Health Agency in their efforts for pandemic readiness through access to the Global Pandemic Fund. We have begun and remain committed to reversing the downward trends made in our national immunization program. We will continue to provide quality health care for persons living with HIV and cancers. We will face head-on the challenges brought on by migration of healthcare workers and will continue to examine new options of financing of healthcare and the creation of digital solutions to enhance our interface with the clients we serve. Ladies and gentlemen, let me again thank the Secretariat for their unswerving commitment to this region, and Barbados remains committed to deepening our relationship with the Pan American Health Organization. I thank you.
Muchas gracias, Barbados.
Thank you very much, Barbados. And now I yield the floor to Puerto Rico. First of all, we want to commend you for your election, very well deserved. Secondly, to apologize on behalf of the interim Secretary for Health in Puerto Rico, who has not been able to arrive on time. I also had to deal with the technical issues that we were supposed to be here at noon. So the day after tomorrow, he will be here, and he will be able to appear before all of you. He entrusted us to congratulate our director for this report, which is all-encompassing, but at the same time, it does touch on specific and unique points which show the reality of health in the Americas and transform or continue to promote PAHO as an accompanying organization providing support to the member countries of the organization to achieve the greatest results in health of many of our peoples. There are areas that we could identify as priority areas, but I believe that it would be up to the minister to bring those to your attention. For the time being, we can say that the elimination of diseases has truly been quite an achievement. And for that, we can share this with the different countries, and we know that there is a very strong and robust movement towards that in the field of Puerto Rico, because we've touched on the elimination of HIV presence and congenital syphilis. We are working strong, and we're also working on the elimination of viral hepatitis. We already have a report that will be mentioned by the minister, and we've added schistosomiasis, which is something that I believe is impressively important. Also, the process of human rabies. We're also very grateful for the contributions made by the organization, particularly in something that has kept us quite busy in the region, such as dengue. Dengue, and we acknowledge the knowledge shared to us by the director, where in the previous meeting of the presidents of the region, they spoke about the Caribbean, and we thank him for his opinion. Although it could be interpreted as just having a few cases, he pointed out that we were preventing the situation from worsening. So this dengue program has been something that has provided us a huge assistance. So I reiterate our warmest congratulations, and we will be present here supporting this directing council. Thank you. Thank you very much, Puerto Rico. And now I give the floor to Spain.
Gracias.
Thank you. I simply take the floor to express my gratitude for the report submitted by Director Barbosa and to commend everyone for the work done by the work of the Pan American Health Organization and for the progress made by all the member states that have spoken before me. In my brief statement, I wish to reiterate Spain's support for the region, for the Pan American Health Organization, and with all its member states. I thus wish to report that in September at the Council of Ministers, we approved the contribution of 3.9 million euros for the organization, and I don't wish to overlook Spain's commitment with the objective of eliminating cervical cancer in the region, an initiative that was presented in the first forum in Cartagena de Indias this last March, and which is aligned with the feminist foreign policy and the commitment towards public health that we keep in Spain. For my country, it is an honor to be here today in this directing council and to be able to work together with you in favor of equity and the right to universal health. Thank you.
Muchas gracias.
Thank you very much, Spain. There is a sub-regional integration organization that has requested the floor, the Andean Health Organization.
¿Escucha? Sí. Bueno.
Can you hear me? Very well. Good afternoon, distinguished participants. Special greetings to Dr. Barbosa. My name is Dr. Maria del Calle Dávila, Executive Secretary of the Andean Health Organization, Hipólito Nane Orazono. First of all, we'd like to commend the Pan American Health Organization for the work done in the course of this year. The cooperation between the Pan American Health Organization and the Andean Health Organization, Oriascono, has a long history behind it, having been strengthened in recent years under the leadership of Dr. Barbosa. It concentrates on dealing with critical issues such as cancer, climate change, inequities, human resources, mental health, immunizations. In August, we had the first Andean week on immunizations on the borders, primary health care, price negotiation. And this joint effort also includes the health of our adolescents and neonatal maternal health, communicable diseases, non-communicable diseases, intercultural health, primary health care, and obviously prioritizing digital health. Last week, we saw the establishment of the Andean Digital Health Committee. We work through committees in the 6 countries where we have focal points represented of the 6 ministries. So all that is done, policies, programs, projects, stem from the ministries. We believe in the 3 I's: innovation, investigation, and investment. So we greet the appetite for innovation, and we commit to equity. Our pillars are the right of all to a higher level of health and the reduction of inequalities and inequities. And obviously, health for us, the Andean Health Organization, is a bridge towards peace and development. The premise that we follow, which is together we're stronger, together we go further, we'll make it far, will continue to guide our joint work. This is our commitment, Dr. Barbosa, attempting to optimize resources and to promote equity in health through policies, programs, and projects for the Andean region that will favor the close to 170 million people in Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. Good afternoon.
Muchas gracias.
Thank you very much to the Andean Health Organization. And now I give the floor to the Council of Ministers of Health of Central America and Dominican Republic.
Buenas tardes.
Good afternoon. Good afternoon, Dr. Barbosa. Thank you very much for this invitation from the Executive Secretariat of the Council of Ministers on Health for Central America and the Dominican Republic. We would like to express our profound gratitude for the continuous technical support provided by PAHO to the 8 member states in the region, and in particular to the Executive Secretariat of the Council of Ministers for Central America and the Dominican Republic. We have a cooperation strategy that was signed 5 years ago and ratified during recent times. And currently we're faced with a new strategy for cooperation where we have a whole set of issues, and I believe that all of these have been exposed by each one of the member states, and they have been reviewed even in the statements themselves and in the political statements made by each one of the participants at the beginning of this directing council. We would like to emphasize that the work from Secomisca is also done in an articulated way by the 8 ministers of health of the region, where their resolutions are binding. So what do we do? Precisely, with the recommendations that are issued and the resolutions that stem from this directing council or the World Health Organization, we turn them into binding resolutions in such a way that member states will be able to comply with these actions in their different countries. I do wish to emphasize that we have important elements of continuous work on important issues for the region, such as addressing the social conclusion of health, health promotion, with a self-care approach, and also with processes that are currently being worked on, such as non-communicable diseases, climate change, digital health, essential public health functions. Each one of the issues that we see are these, and those that will be examined in this directing council. So on our part, would like to reiterate our gratitude to PAHO and the commitment to be able to implement and develop the cooperation strategy that we're currently reviewing and developing for the coming years. This is the only way for us to make this possible, being able to comply with what is established and then meet the SDGs and to think of improving the health of our peoples. Thank you.
Muchas gracias al Consejo de Ministros.
Thank you very much to the Council of Ministers of Central America and the Dominican Republic. And now I call on Dr. Barbosa so that he can reply to the comments made by the various participants. Dr. Barbosa.
I think that's very brief. First, I want to thank you for the 22 member states that have made their comments. I think that I want to share your appreciation to all our staff, our enabling departments, our technical departments, the centers, the country offices, because they are really the main work to support you, to provide technical cooperation and to advance the health agenda in the Americas. I think that I always want to thank you for sharing with us the many advancements that we are implementing in your countries, and I think that is so good to see that we are really in a unique situation with a full alignment, because many countries talked about the same priorities. They talked about the strengthening primary health care. Some countries share with us the efforts that they are doing to transform their health system. They talk about the need to improve the healthcare workforce. They talked about the elimination of diseases. They talked about what they are doing to improve the how primary health care can reduce the preventable deaths related to non-communicable diseases, how they are dealing with the current public health emergency that we have, dengue outbreak, climate change impact, and many other priorities, regional production, mental health. So I think that when we listen, we see that, of course, with difference that we have among our countries, because we have huge countries, we have small island developing states, but I think that it's very clear that we have a very important consensus about the public health agenda in our region, and this clearly will reflect not only in the discussions that we will have this year, but also in the strategic plan 2031 that we have already started the discussion and we will approve next year. So I really want to thank you for sharing these progresses. It is many important things that you are implementing in each one of the countries in our region, and I acknowledge and I commend you for these many important strides that you are promoting in our region. Me gostaria também de agradecer.
I would also like to express my gratitude to the mechanisms of integration, the Executive Secretariat of Comisca and ONASCONU. These are sister organizations, and we all work together in order to do all this work in those subregions. It is very important, just like what we do with CARICOM and what we do with Mercosur, in order to look for that integration of our agendas and to see how we can work in a more energetic way in the region. I would also like to express my gratitude to Spain for announcing that significant contribution. Besides the quotas that we receive from the countries, I believe that you all know that an important part of the work we do in the region on many important issues can only be done thanks to voluntary contributions that in a generous way we receive from member states such as the US, Canada, but also from other observer states, as is the case with Spain and other important partners. This has enabled us to greatly expand the progress we achieve on important issues such as sexual and reproductive health and the actions to reduce maternal mortality, to move forward with regional production, to move forward with the elimination of diseases. So I would very much like to thank Spain, and on behalf of Spain to all partners, all those who participate and who've supported the implementation of the work we do on the territories, on the countries, particularly with the most vulnerable populations, those that face the most important barriers to having access, the access they need, and that are entitled to health services. Thank you very much, Madam Chair.
Muchas gracias.
Thank you very much, Dr. Barbosa. I would like to let the Council know that the debate will be reflected in the final report. And now I move on to the next item, which is agenda item 2.4, report of the General Committee. The General Committee, under the guidance of the chairperson of the Directing Council and with the participation of the 2 vice chairs and the rapporteur, as well as the delegates are from Cuba, the U.S. of A., St. Kitts and Nevis, held its meeting on Monday, September 30th at 1 p.m. in Washington, D.C. As a result of the deliberations, the General Committee arrived at the following decisions. 1. The working schedule of the Council will be as follows. In the morning, from Monday to Thursday, from 9 a.m. to 12:30 p.m. In the afternoon, Monday from 2:30 to 3:30, Tuesday from 2:30 to 5 p.m., and on Wednesday and Thursday from 2:30 to 5:30 p.m. So the early closing of the meeting on Monday and Tuesday will enable us to have plenty of time in order to hold information sessions. 2. We've set the schedule for the elections for the vacancies in the Executive Committee. The vacancies in the Advisory Committee for the Latin American and Caribbean Center for Information on Health Sciences, and the selection of 2 member states for the region of the Americas, empowered to designate a person to join the Committee on Policy and Coordination of the Special Program UNDP, Young UNFA, UNICEF, WHO, World Bank, on research, development, and training of researcher on human reproduction for Wednesday, October 2nd in the morning.
175 sesión del comité.
At the 175th meeting of the Executive Committee, this will take place on Friday in Room B, or as soon as we conclude the 61st Directing Council. Are we all in agreement?
Si no hay objeción, declaro.
If there is no objection, the report is approved.
Ahora continuamos.
Let's continue now to 2.1, first report of the Credentials Committee. I now call on the delegation of Canada. The chair of the Credentials Committee to present the first report of the committee.
First report of the Committee on Credentials. In accordance with Rule 31 of the Rules of Procedure of the Directing Council, the Committee on Credentials appointed at the first meeting and consisting of the delegates of Canada, Ecuador, and Jamaica held its first session on 30 September 2024 at 10:30 a.m. It elected Canada as president. The committee examined the credentials delivered to the director of the Pan American Sanitary Bureau in accordance with Rule 4 of the Rules of Procedure of the Directing Council. The credentials of the delegates of the member and participating states and associate members and observer states listed below were found to be in good order, and the committee therefore proposes that the Directing Council recognize their validity. Member and participating states: Antigua and Barbuda, Bahamas, Bolivia, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Dominica, Dominican Republic, Ecuador, El Salvador, Guatemala, Guyana, Haiti, Jamaica, Panama, Paraguay, Peru, St. Kitts and Nevis, St. Lucia, St. Vincent and the Grenadines, Trinidad and Tobago, United Kingdom, United States of America. Countries whose names were not read should expedite issuance of their credentials and deliver them urgently to the registration desk. The committee will meet again to examine other credentials that are received. Delegates are reminded that those from member and participating states who do not submit their credentials as required will not be entitled to vote.
Muchas gracias, Canadá. ¿Están todos de acuerdo?
Thank you very much, Canada. Is everyone in agreement? If there is no objection, I declare the report approved. The Credentials Committee will meet again on Tuesday during the coffee break in the morning and will present their second report in the afternoon. I now call on the Secretary, who will make some announcements. Thank you, Madam Chair.
Remind the members of the Working Party to study the application of Article 6B of the Constitution. That the first meeting will take place in room 712 on the 7th floor during the coffee break right after this meeting. We would like to inform delegates that the adopted agenda has been published in the 4 official languages. Also, we would like to inform delegates that at the end of this session, the briefing session on the pandemic accord will take place in this room. And finally, at 6 p.m., our director will host a reception in honor of the participants of the Directing Council. This reception will take place in the headquarters building patio on the ground level. Thank you.
Muchas gracias.
Thank you, Mr. Secretary. We leave until tomorrow the following items: 4.1, 2.3, 5.1, 5.2, 5.3, 4.3, 4.2, 2.1, 4.4, 4.5, 2.3, 7.1, 4.6, and 4.7.
Bueno, con esto.
With this, we have concluded our work for today. We will be back here tomorrow at 9 a.m. And those of you who are interested, at 4 p.m. we will meet here again.
Aprobado.
Approved.
So AMTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness, and we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
Since 2021, the Pan American Health Organization, PAHO, has been implementing the Improved Health of Women and Adolescent Girls in Situations of Vulnerability project in Bolivia, Colombia, Ecuador, Guyana, Honduras, and Peru. With financial support from the Government of Canada, this project addresses some of the most pressing challenges related to the health of women and adolescents.
In a post-pandemic context, where we have seen setbacks in sexual and reproductive health indicators, including the maternal health, the interventions of this project are more critical than ever to recuperate lost public health gains, reduce health disparities, and promote informed health decisions among women and adolescents.
By strengthening the capacities of more than 45,600 people, including healthcare providers, public servants, and community health workers, such as traditional midwives, the project has contributed to strengthening health systems from primary care and expanding access to sexual and reproductive health services in the 6 countries. The project has also supported the creation of about 100 technical guidelines to improve the quality of care and has developed innovative telehealth initiatives to optimize maternal and neonatal health outcomes. Taking a comprehensive approach and promoting gender equality, the project has fostered the empowerment of women and adolescents so they can make informed decisions about their well-being and actively participate in matters related to their sexual and reproductive health rights.
Evidence shows that investing in the sexual and reproductive health and rights of women and girls improves the quality and accessibility of comprehensive health care for everyone.
Additionally, considering cultural diversity, the Knowledge Dialogues methodology has been implemented by exchanging perspectives on issues such as teenage pregnancy and gender-based violence, encouraging communities to increasingly attend health centers. The project is carried out in coordination with ministries of health, civil society, and community leaders in the 6 countries, creating spaces for exchange, capacity building, and knowledge transfer. The alliance between the Government of Canada and PAHO is essential to continue efforts to improve the health of women and adolescents in situations of vulnerability. This collaboration aims not only to advance towards the achievement of the Sustainable Development Goals, but also to continue to positively impact the lives of women so that in the near future, all can exercise the sexual and reproductive health rights, leaving no one behind.
Global Affairs Canada is a key and long-standing partner. We share common priorities in promoting health equity, gender equality, and women's sexual and reproductive health and rights. Thanks to our alliance,